Hello, 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 my friends. Jill Osborne, IT Network. We have started Facebook. All right, what's going on there? All right. Hello, guys. Jill Osborne, IC Network. It's time for our National IC Support Group meeting. Hold on one sec. Got to get this all fixed. You know, I lost my mouse on my other computer, which I used to stream Facebook. So I'm using a backup mouse. It's very, very slow. Let's see. Internet's being very weird today. So let me make sure I got this right. Okay, I got that right. Hi, Laura. How are you, hun? Nice to see you. Things are really off here a little bit, so I'm not quite sure what's going on. Hi, Trisha. Okay, there we go. Hello, everybody. Hello. I hope you're having a very good day today. I'm having a pretty good day today so far. Slept well last night. Didn't get up once. Nocturia. Yeah, we've got that under control. Hi, Shell. Nice to see you. Nice to see you. A little bit late starting today because I had to get my mom all straightened out. But other than that, we are good to go. But again, the internet's being kind of weird. So what we're doing, guys, this is our National IC Support Group meeting, and it's always technology, technology dependent, for lack of a better term. Hi, Mary. Nice to see you. So my name is Jill Osborne, President, Founder, IC Network, National IC Support Group Leader. There's something on my glasses. So I've been a support group leader now for 28 years. I bring you a lot of college degrees, which in hindsight, maybe didn't quite, I always think about my friends who didn't go to college and get all these degrees like I did. And they got their houses a lot earlier than I did. That's pretty funny. That's pretty funny. Anyway, I've got a degree in chemistry, degree in pharmacology, drug development, master's degree in psychology, and the IC Network was my doctoral dissertation proposal and bringing support to patients who were homebound. I've been doing this for quite a long time, sat on the U.S. Army IC research panel for a decade. And so when you come to one of my meetings, we have a lot of stuff coming up this fall. We're going to be doing some television. We're going to be doing a few more things like that too, to really get the word out about IC and pelvic pain. All right, so let's hold on here. Let me move that up there. That'll be helpful. Yeah, baby. That might be a little bit better. All righty, my friends. And so everybody is welcome here. I welcome IC patients, family members, partners, daughters, friends, whoever. Everybody is welcome. And my job here is to educate you. It's to inform you. It's to give you all the information that you need so that we can open up potentially some new doors of treatment. Because here's the reality. A lot of patients have been diagnosed with IC. They've been put on bladder meds and they've never gotten better. Why? Because for some of you, this is not a bladder disease. For some of you, there's something outside of the bladder, in the pelvis, maybe at the spine, even the central nervous system, which could potentially be causing your symptoms. And so today we consider IC a pelvic pain syndrome. Why? Because we know structures outside of the bladder are often involved, if not always involved. And so we now do something called subtyping. These glasses are just driving me crazy here. Hold on a sec. Where instead of you just being told you've got an incurable bladder disease, now if you've got the symptoms of frequency, urgency, pressure, pain, we're going to be looking at a lot more stuff than just the bladder. And here's the reality. The bladder only knows one language: frequency, urgency, pressure, pain. The only way that it can tell you that there's a problem is by giving you these symptoms of frequency, urgency, pressure, pain. So you could have a bullet wound and it would feel like infection. You could have a stab wound, it would feel like infection. You could have cancer and it would feel like infection. You only have two nerves in your bladder. You got your alpha afferent nerves, which cause frequency, urgency, and you got the C fibers, which do pain, right? And so I know you think it's infection for some of you, and I know, or you think it's your bladder for some of you, and that certainly does make sense. But it's important that you take a step back and we consider the concept of cause and effect, because your bladder symptoms are an effect. We have to figure out the cause. And so it could be endometriosis on your bladder. It could be a Tarlov cyst coming off of your spinal cord. It could be a genuine bladder wall issue where if you've gone through chemotherapy, then yeah, man, your bladder's chemically irritated and that's going to cause some issues. It could be a screwed up tailbone, where if your tailbone's healed out of position, bam, your pelvic floor muscles are going to get tight and you're going to have trouble. And it could be something related to your bladder. It could be a bladder infection. It could be a chronic infection, but it might not just be bacteria. It could be fungus. We now know that quite a few IC patients have fungal infections in their urine or in their urinary tract, or it could be viral infections. So I was working with a patient last week, very interesting case, because she has Hunner's lesions. Hunner's lesions are considered the worst form of IC. They're big bloody wounds on the bladder wall, right? And so Hunner's lesions have always been considered the most difficult to treat. Patients with Hunner's lesions have the most restricted diet. There's no doubt about that. And the question is what causes Hunner's lesions? What causes these big bleeding wounds in the bladder? And there are a lot of theories and there are a lot of guesses, but it's not the same thing for everybody, right? So there is one theory that the reason why patients have Hunner's lesions is that the nerves are super, super irritated. And when a nerve is irritated, it releases a substance called substance P, and substance P is quite damaging to nerves, okay? Or it could be some type of chronic infection. Guys, I got to fix Facebook here for a moment. Hold on a sec. Is that better for Facebook? There you go. For some of you, it could be chronic infection. So I was working with a patient last week, and she had something that we really don't see that often. And that is that she had her lesions treated, right? They were treated. And yet immediately she had 2 lesions, 6 new lesions developed. It's like, what? Now, wait a second. Normally when we have lesions, what we're going to do is lesion-specific therapy. We're going to cauterize the lesion or inject steroid into a lesion, because there's a lot of inflammation in lesions. It's a warfare happening. When you biopsy a lesion, there's massive inflammation in there. And so here she had 2 lesions. She gets them treated by literally one of the best doctors in the United States. And bam, 6 new ones happened. Like, what the hell? Normally lesions, once you treat them, they reduce in number. And in hers, exploded in number. Why? Well, now we get into some of the research from Europe and also the United States. And it was the Europeans who first discovered a virus in the urine of patients with Hunner's lesions, specifically a virus called the polyomyv virus. And so, she and I talked. She had attended one of these meetings. For all I know, you're watching right now. If you are, you know who you are. And so I suggested that she get a viral test. So she had a blood test, which can test for virus in her bloodstream. And you know what? She had virus, and she had a lot of virus. She had Epstein-Barr. Massive amount of virus. So now the question is can Epstein-Barr be found in the bladder? And the answer is yes. And so as we're trying to solve the mystery of why you are struggling with your symptoms, you just can't keep thinking it's this weird, obscure disease of my bladder, because in many cases it really is explainable. So anyway, when I do these meetings, my job is to open new doors of therapy for you. My job is to open your eyes to new possibilities. If you are newly diagnosed, we need to Look at the subtypes of IC. Subtype number 1, Hunner's lesion. Subtype number 2, bladder wall driven. Subtype number 3, pelvic floor driven. Subtype number 4, pudendal neuralgia. Subtype number 5, central sensitization, chronic overlapping pain conditions, which is a central nervous system disorder, which happens to be one of my subtypes. Okay. But if you're also kind of a grizzled IC veteran where, man, you have been on every freaking bladder therapy out there and you're simply not getting better and you're living in this stasis of flare, couple days good, week good, month good, bam, flare, good, and you just want this to be over. You want to be healed. And what the American Urology Association says is that if you're not responding to therapy, if you're getting worse rather than better, we have got to revisit the diagnosis here. What have we missed? What have we missed? And the odds are they really could have missed something, because here's the deal. Western medicine fails the IC patient and the pelvic pain patient because doctors like to play in their sandbox. Urologists stay in the urinary tract. Gynecologists stay in the reproductive tract. Gastroenterologists stay in the bowel. They don't look at relationships. And here's the thing about the pelvis. This is a small confined area with a lot of stuff going on, and these organs do not operate in isolation. Things influence each other. If you've got a tender bladder that's screaming in pain, your muscles are going to get tight, and that's going to start restricting blood flow. If you've got tight muscles from an injury, that's going to restrict blood flow to the bladder, and then your bladder wall is going to break down, and that's going to be an issue too, right? So we are doing a much more exhaustive diagnostic workup here. Now, normally when I do these meetings, I do a good 20, 25 minutes of a little mini lecture, and then I take your questions for however long you want to go. We have done it 2 hours. We have done it 5 hours. I am here at your pleasure. And normally we might also do a Zoom meeting where you can come in and ask your own questions, because you are kind of here stuck listening to me, and I apologize for that. Again, we've got some really good things coming up. So what I wanted to, and here, hold on a sec. And you guys on Facebook, my computer over here, the mouse died, and I'm using a backup mouse, and it's slow. Hi, Trisha. Hi, Shell. Hi, Mary Crow. Hello, Anne. Blood and urine and incontinence, are they seen in IC? Blood and urine is almost always seen in IC. Almost all of us have microscopic blood in our urine. Incontinence, not a symptom of IC at all. Incontinence is telling us that you have overactive bladder or you have very weak muscles. Rebecca says, thank you for your videos. You're welcome. I love doing them. We're going to do a lot more. Got some really exciting stuff happening. Linda says, are you allowed to ask questions? You are absolutely allowed to ask questions. Just know that here on Facebook, sometimes we get so many, I miss them. And so if I miss your question, just keep asking it until I get it. And again, I'm going to do a little educational thing before I start taking your other questions. So, I just, I haven't talked about it for a while. I want to talk a little bit about diet here, because we are working right now on our summer magazine. That's your quick cover. I can't let you see the headlines because this is not the current one. Nope. But this is the cover of our summer magazine, which will be out on, it'll be at the printer, and it'll probably be done on Wednesday. I'll be putting the electronic versions up tomorrow or Tuesday for all of our members in our in your member page. So if you guys love your IC information and you love learning more, and you are dedicated, you are invested in wanting to get better, make sure you sign up for an IC Network membership, because you get our great magazine. This is our 19th year of doing this magazine. Anyway, I asked a new registered dietitian. Her name is Callie, who is now very involved in the IC movement, to help me with a very, very important topic. And that is that some of you, especially patients with Hunner's lesions, some of you are not eating enough, not even close. Some of you are down to eating 4 or 5 foods. Okay, now why? Usually that's the patient with Hunner's lesions. That's a patient with advanced Hunner's lesions. Their bladder is so freaking sensitive, they are just down to eating a few foods. And the challenge is, over time, that can lead to extreme vitamin deficiencies and maybe even malnutrition. Now, why is the bladder sensitive to food? Again, we have to look at our subtypes. If you've got Hunner's lesions on your bladder, big bloody wounds on your bladder, man, your bladder is going to be freaking sensitive. There's no doubt about that. You're not going to be able to drink coffee or soda without being up all night and or potentially being in a lot of pain. Okay. If you're an IC subtype 2 bladder wall driven from chemotherapy or from aging and estrogen atrophy, you too are going to have issues with food because your bladder doesn't have its normal natural defenses. It doesn't have that nice thick coating of mucus, which normally protects those tissues. Right. And so you too are going to be more diet sensitive. You're not going to be as extreme as Hunner's lesion patients. But again, because your bladder can't defend itself because it doesn't have a nice thick coating of mucus anymore, you're not going to be able to drink a lot of coffee or green tea or soda or anything like that right now until we improve the quality and health of your bladder. It is what it is. Okay. IC subtype 3, pelvic floor driven, you're probably not diet sensitive. Pudendal neuralgia, IC subtype 4, you're probably not diet sensitive. IC subtype 5, central sensitization, which means that we have a very sensitive nervous system, especially the small fiber nerves in our bladder wall, as well as in our skin. We are going to be more sensitive, but we're going to be more sensitive to stimulants like caffeine, right? And so we have to protect our bladders. It's never going to be in our best interest to be doing anything with caffeine because our nervous system is already so sensitive. The last thing we want to do is take a jackhammer to it. Right? And that's what caffeine is. Caffeine is a jackhammer to the nervous system. So again, if you're an IC subtype 1, Hunner's lesions, you are absolutely diet sensitive. And if you're still drinking coffee, you're foolish. You're foolish because you got a big open wound in your bladder. And if you're bathing that wound in acid every single day, that wound will never get better. Never get better. If you're an IC subtype 2 bladder wall driven because your bladder can't defend itself, again, you're going to be sensitive. But again, pelvic floor not as sensitive, pudendal neuralgia not as sensitive, and IC subtype 5 central sensitization, you are going to be more sensitive, but probably more to caffeinated products. So anyway, as I said earlier, for some of you, there's no doubt that you're just not eating well. And also for some of you, there's a tremendous fear of food. And I do not want you to be afraid of food. There's no reason for you to be afraid of food. The IC diet is a simple, fresh, healthy diet. What doesn't work for us is the pre-manufactured foods in the middle of the supermarket. You could do the outer aisles. Can you do dairy? Yeah, probably, as long as you're not lactose intolerant. Can you do meat? Absolutely. Just don't put hot sauce on it or a hot spicy barbecue sauce on it. You can certainly have a grilled chicken breast. You can certainly have a steak. Can you have cayenne coating on that chicken? No, probably not. That's probably not going to work for you. Are you going to be able to put A1 steak sauce on your steak? Nah, probably not. It would be better to use maybe some sauteed mushrooms like that. Good salt and pepper steak, not a problem there. The vegetable aisle is your friend. You can eat a ton of veggies, a ton of veggies. You can eat almost every veggie except for, tomato. We don't want you to do concentrated tomato. And I know technically tomatoes are fruit, but anyway, it is what it is. So squash, absolutely. You can eat it. Mushrooms, yes. Celery, carrots, yes. Broccoli, it should be fine unless you've got an issue with gas. Like I don't eat cabbage. I don't eat Brussels sprouts. You couldn't pay me to eat those because it just doesn't work for me there. But the vegetable aisle is your friend, and so is the fruit aisle. I mean, the only fruits we really need you to be careful of are going to be the citrus fruits, going to be the lemons, the limes, the grapefruits. But can you have apples? Gala apple, Fuji apple, those are the lowest acid. Great. If you want to have apple pie, make it. Get some Gala apples, make some, get some good organic flour, and follow the Betty Crocker recipe. Make yourself some apple pie. I make it frequently. I'm like the queen of pies in my house. I love making pies. Hey man, fall's coming. Pumpkin. You can do pumpkin. No problem with pumpkin at all. Pumpkin works for us. Absolutely works for us. So does, any of those winter squashes, even artichokes, some of the fancy ones, The vegetable aisle is your friend. The fruit aisle is your friend. Blackberries are great right now. Blueberries are great right now. Strawberries, a little bit more acidic. Maybe you don't want to eat a lot of strawberries in any one sitting, but a little handful of strawberries might be okay. Certainly the melons, cantaloupes, the honeydews, the watermelons, those should be fine too. Not really worried about those. Again, it's really going to be the citrus and the foods in the middle of your grocery store, especially drinks. Especially drinks, because here's the deal. You got to remember that our bodies were designed starting millions of years ago. But of course, we have evolutionary adaptation, so we adapt over time. But the bladders we have today is the bladder that was designed 5,000 years ago, before the invention of coffee and soda. And so our bladder may not have the defenses to withstand constant acid every day, all day long. Especially, it depends upon your heritage. Now, like, I'm Norwegian and Swedish, right? Like, my family comes from northern Norway. We're talking Arctic Circle. The only acid my ancestors had was once a year when the berries were ripening. And if they ate unripe berries, those were acidic. The riper the fruit, the less the acid. So my body didn't have to adapt to a lot of acid because we just didn't have it. You compare that to somebody who grew up, whose family is from the equator area. Man, you had fruit all year long, and you had acidic fruit all year long, potentially. So your bladder and your body may be a little bit more capable of handling a lot of acid over time than mine. Mine certainly is a little bit different. But honestly, it doesn't matter where you're from. Drinking soda all day, every day is devastating. And if you read my blog over on the IC Network website, icnetwork.org, you'll see we have a brand new study that proves that diet soda, specifically aspartame, there's no doubt about it, causes cancer. It causes cancer. Why? Because aspartame is broken down first into methanol in your body, wood alcohol. Y'all remember 6 months ago when the US FDA was issuing all these warnings about hand sanitizers with methanol, telling you not to use them? Methanol is toxic. I had a girl die in my dorm at UC Santa Barbara because she drank methanol. I was there. I cleaned up the blood. The paramedics tried to revive her for about an hour before they took her out. I'm the one who cleaned up the blood afterwards because I was an RA in the dorms. She died because of methanol poisoning. How tragic is that? And it happens every year around the world. Hundreds and hundreds of people die because of methanol poisoning. But here's where it gets even worse. Methanol is then now broken down into formaldehyde and formic acid. Formaldehyde. Formaldehyde is a proven carcinogen. It's a proven carcinogen. And so when aspartame was approved, they approved it on the basis of 2 small rat studies of about 40 rats each, and it appeared to look pretty good. And so the FDA approved it. Some researchers in Europe did what we call kind of a super study, where they studied animals from birth to death, a natural death, and they studied them within the context of exposure to aspartame. And their early research showed that the more that person or the animal is exposed to aspartame, the greater the risk of lymphomas and all sorts of other cancers. Now, when they presented that data, everybody said, "Yeah, you're wrong. There's no way it's that bad." And they suggested that that the animals were infected with something. And so the researchers went back and they did very specific DNA testing of the cancerous lesions, and they just published that data. And there's no doubt about it. Animals exposed to aspartame develop cancer. And what they found is if the aspartame was being given to a pregnant mother, The babies, the fetuses, were far more likely to develop cancer. So they presented that brand new data this summer, and it's stunning. There is no doubt. So again, when we're talking about creating an environment that will help your bladder heal, for God's sake, don't put formaldehyde in it. You can read more about that on our website. Okay, I just published a blog on our website. So as you're thinking about your dietary choices, you got to ask yourself, what would I put on a wound on my hand? Well, you put water on it or milk on it, right? Well, you wouldn't really put milk on it, but that makes a little bit more sense. You wouldn't pour acid vinegar on a wound every single day. What would happen to that wound if you poured acid on it? It would never heal. And that's why people who drink soda every day or coffee every day struggle with long-term chronic pain and discomfort, because you're not giving your bladder an opportunity to heal. Because the reality is that healing is always happens. If you're an IC subtype 2, chemotherapy, your bladder, or a chemical injury, and your bladder's been injured, maybe by drinking too much diet soda or soda, healing will happen if you stop getting in the way of it, which means you can't pour acid on the wound. You have to create an environment that support healing. And some of you go, okay, I'll do the diet, and you do it for a week. And then you don't get better. And you go, well, it doesn't work, so I'm going to go back on the foods. Nothing can happen if you change your diet for a week. It is physically impossible for your bladder to repair itself in a week. It takes 2 weeks for one cell to be replaced. 2 weeks. So at a minimum, you've got to be on the diet 6 weeks, 3 months, to really give your bladder an opportunity to heal. Ideally, for that 6-week period, water. It would be okay to do chamomile herbal tea or peppermint herbal tea, or maybe even rooibos tea, but that's it. That's it. We're trying to help that tissue heal, and you got to give it time to heal. The thing is if you keep pouring acid on that wound is going to get bigger, the nerves are going to get more inflamed and more irritated, and you are in for a world of hurt. You're in for a world of hurt. So anyway, a simple, healthy, fresh diet is the way to go here. But let's get back to the point that I was trying to make, is that some of you are so diet sensitive that you're down to eating 4 to 5 foods. And that's really, really hard, because you will absolutely become vitamin deficient and potentially develop malnutrition. And so I asked Callie Cragier, a new registered dietitian who's working with the IC network now. Her website is callieknutrition.com, to help us understand some of the symptoms of vitamin deficiency, as well as to help us understand the best foods you could eat to get that vitamin. And I just kind of wanted to go over this with you. So let's talk about vitamin C for a moment. Vitamin C is the one that every IC patient is going to be more cautious of. Why? Because it's ascorbic acid. And of all the acids out there that irritate the bladder, it's going to be ascorbic acid or citric acid. Okay. There is a low acid form of vitamin C called calcium ascorbate that you might be able to get to tolerate. In fact, it's right in the corner back there in that orange bottle. It's called ester C. So vitamins, let's see. Well, I don't need to tell you all the things it does. You can read about it in the article. It's an antioxidant. It helps to, it's basically kind of a soldier that helps defend your body against potential threats like cancer, cardiovascular disease, and things like that. Helps your body absorb iron, et cetera, et cetera. Let's see. So if you are vitamin C deficient, what we're going to be looking for is weakness, unexplained exhaustion, a decrease in appetite, irritability, muscle pain, bleeding of the gums, spontaneous bleeding, and bruising. And it takes about 3 months for you to develop a vitamin C deficiency. The recommended daily amounts are 75 milligrams for women and 90 milligrams for men. So what are the foods that you can eat that are bladder friendly that will give you vitamin C? Well, let's go through this. Broccoli. Yeah, I love broccoli. 51 milligrams in a half cup of broccoli. Seriously, you eat a cup of broccoli, you're good for the day. Brussels sprouts. I don't like Brussels sprouts. cauliflower, spinach, bell peppers. Bell peppers, 60 to 95 milligrams of vitamin C. Blueberries, cantaloupe, watermelon, parsley, kale, squash, zucchini, cooked white or sweet potatoes. All right. So there are a lot of foods that you can eat that are not citrus based, that are high in vitamin C, that are going to help you maintain your good vitamin C levels. Now let's go to B6, because B6 is the other vitamin that we know can irritate the bladder. And we still have a little bit of confusion as to why that happens. We think it's because of the chemical form of it. B6 is involved in the breakdown of protein, plays a role in cognition, immune function, and the development of hemoglobin, which we certainly all need. Vitamin B6 can be found in chickpeas, also known as garbanzo beans, tuna, salmon, cottage cheese, rice, squash, potatoes, nuts, spinach, and watermelon. A deficiency of vitamin D is frequently accompanied by deficiency of other vitamins. So what are the signs of that you're vitamin B deficient? Anemia, EEG abnormalities, cracks in the corner of your mouth. Anybody have cracks in the corner of your mouth? Glossitis, also known as a swollen tongue. People with mild vitamin B deficiency may not present with symptoms for several months, if not years, but it can be subtle. People at higher risk of vitamin B deficiency are those who have celiac disease, Crohn's disease, and ulcerative colitis, as well as some autoimmune disorders. All righty. All right, now here's a vitamin that people are worried will irritate their bladder, but it does not irritate your bladder. It's rare that this would irritate your bladder. B12. And one of the things that we have kind of tracked over time in patients, and I don't have a specific study that I can reference here. This is more kind of firsthand knowledge more than anything else, is that I see patients over time appear to develop a B12 deficiency and a vitamin D deficiency. But I can't say why that happens. In some cases, it may just be related to aging. But anyway, with B12, if you're B12 deficient, don't worry that B12 is going to irritate your bladder. It does not irritate your bladder. So what does B12 do? It is essential for the development and functioning of the nervous system, as well as DNA synthesis and red blood cell formation. Let's see. So it is naturally found in animal proteins such as fish, meat, poultry, eggs, and dairy, as well as in fortified cereal and nutritional yeast. It appears that the absorption of B12 is 3 times higher in dairy products than in meat. IC-friendly sources of B12 include beef, beef liver, clams, tuna, nutritional yeast, salmon, milk, yogurt, fortified breakfast cereal, cheese, eggs, and turkey. Okay? So B12, you're good. A deficiency of B12, well, let's see, can be caused by a lack of an intrinsic factor that helps it be absorbed, surgery in the GI tract, prolonged use of certain medications, and dietary deficiency. The signs of B12 deficiency are going to be anemia, swelling of the tongue, fatigue, heart palpitations, pale skin, dementia, weight loss, and infertility. Okay? You might also experience some numbness or tingling in your hands and feet. Symptoms of deficiency can take years to develop. All right. People at risk are older adults, etc. Okay. Anyway, we got that. Okay. So B12, clearly important. Vitamin D is also one you do not have to worry about. Vitamin D should not irritate your bladder at all. Vitamin deficiency in D can lead to rickets, osteoporosis, and muscle weakness. Some people may even be diagnosed with fibromyalgia due to its mistaken muscle pain from a vitamin D deficiency. Now, depending upon where you live or what season it is, it may be impossible to get the recommended amount of vitamin D from the sun. We can't absorb UV rays in the car on cloudy days. UVB rays can't penetrate our clothing either. So obviously, being out in the sun like 5 or 10 minutes a day, if possible, would be ideal if we're trying to improve your vitamin D levels. If you're going to do a supplement, calcitrol is the best form to use according to this registered dietitian. It happens to be incredibly inexpensive. Also, icy-friendly sources of vitamin D include oily fish such as trout, salmon, red meat, fortified cow's milk, eggs, mushrooms, and breakfast cereals. All right? Iron. Iron. Again, you don't have to worry about iron. Iron should not irritate your bladder at all, although it could irritate your stomach if you are anemic and you need to take extra iron like my mother does. Obviously, iron is essential to make hemoglobin, which carries oxygen, right? And so we need lots of good hemoglobin in our body, which means we need a good source of iron in our body. Vegans and vegetarians who do not eat meat are at risk of iron deficiency because the iron in plant proteins is not digested as well as iron in animal proteins. Foods that are iron rich and IC friendly are going to be lean meats, poultries, seafoods, fortified breakfast cereals, oysters, white beans, lentils, spinach, kidneys, chickpeas, white potato, and cashews. Ugh. The last time I ate cashews, God, I had gas for 24 hours. It was so weird. Iron deficiency is not, you do not see it immediately because what happens is if you're low in iron, your body then will use its reserves. But once those reserves are depleted, you're going to have GI upset, weakness, fatigue, or problems concentrating. Okay. Calcium. Calcium, again, IC friendly. You don't have to worry about that too much. Calcium is a mineral used in the body to maintain strong muscles, bones, nerves, and blood vessels. Calcium can be found in milk, yogurt, cheese, kale, broccoli, canned sardines, salmon, fortified breakfast cereals, and some breads. Calcium is also found in many supplements. The two forms are calcium carbonate and calcium citrate. Here's one of the questions we get all the time. What's the right form of calcium an IC patient should use? Calcium citrate can be absorbed on an empty stomach, whereas calcium carbonate cannot. But most importantly, your body can only absorb 500 milligrams at a time. So there's no reason for you to take 2,000 milligrams of calcium. It's impossible for your body to use that. Rather, you may need to take 2 500 milligram doses at different times of the day. And if you are calcium deficient, you might have osteopenia or osteoporosis that is associated with very severe calcium deficiencies. The only challenge with calcium supplements is they can cause constipation, but they should not irritate your bladder at all. Thus, when you're using it, we want to make sure you're drinking plenty of water and using some fiber. And then last but not least, multivitamins. Multivitamins are certainly going to be your go-to for those of you who are really restricted from a diet standpoint. The problem is that 99% of multivitamins out there use ascorbic acid for their vitamin C, which is an acid bomb. I've had terrible flares from doing one-a-day vitamins, Centrum vitamins, because there's simply too much ascorbic acid in it. You need a low acid multivitamin. And a low acid multivitamin uses calcium glycerophosphate for the calcium and also because it reduces acid levels. And so there are only a couple of low acid multivitamins on the market. The one that I use personally is called Bladder Smart and made by Natural Approach Nutrition. One of the reasons why I like that one is because you can titrate the dose. It's not like it's a giant, horse pill that you've got to swallow. It's smaller pills, and you can take 1 or 2 or 3 a day. I do that before I go to bed, and I have to say, I think my diet was very, very limited the first 10 years of my IC before we knew about subtypes, before we realized more of what was going on. My bladder, while it's perfectly healthy, there's nothing physically wrong with my bladder other than now a little bit of estrogen atrophy because of my age. And, my muscles are nice and relaxed. My bladder is getting really good blood supply now because my muscles are in good shape. Thus, I can actually do multivitamins, but I choose to do the low acid multivitamins. So to sum up here, listen, I don't want you to be afraid of food. There's no reason for you to be afraid to eat when you've got IC and or a tender bladder. But it is going to be a wake-up call if you've lived on junk food and soda and coffee all day, because that's not going to be conducive to helping to heal your bladder wall. Because the one thing you can absolutely count on is that healing is always happening. That never turns off. Your body is trying right now to heal whatever the hell is wrong with you. But if you get in the way and you pour acid on that wound, it's going to be very hard for your bladder to ever heal. And I think we all agree. I was at a National Institutes of Health meeting that was and attended a lecture by Dr. Anthony Schaefer, who talked about bladder wall healing. And basically, what he said is every time you pour an acid in the bladder, you set yourself 2 weeks back of tissue healing. And that's just not going to get you where you need to go. You have to give your bladder some time to heal before you can go back and maybe try some of those risk foods. Are you going to ever be able to drink diet soda every day in large quantities? Hell no. I think you'd be an idiot if you were doing that because of the research with aspartame. But also because of the long-term toll of acid exposure on your bladder. But will you be able to do one a week? Maybe, maybe. I've had I mean, like, literally, I will do 1 soda every 5 years. I don't like soda. It's too sweet. I'm gonna do instead a Italian soda where I'm gonna get some sparkling water and some soda flavoring and do it that way, and that works really well. So if you can get some sparkling water and you can get maybe some raspberry Italian soda flavoring or coconut Italian or blueberry, one of the icy friendly flavors, you can make yourself bladder friendly flavor sodas that do not have the massive level of acid as well as some of the other ingredients that can potentially be irritating. Over on our other website, guys, we've got a lot of websites on IC. We've got icnetwork.org. We've got icawareness.org because hello, IC Awareness Month starts in 3 weeks. But the website that I love doing is called the IC Diet Project, icdietproject.com. That's where we've got some of the best authors and cookbook authors who contribute articles several times a year. And there's a huge archive of articles of icy friendly foods that you can enjoy, as well as low acid forms of. I mean, there's just so many good things over there. But there are a lot of recipes for icy friendly drinks. And so please go on over to icdietproject.com and check that out because that might give you some really, really good ideas on some foods that you can enjoy. Alrighty? Okay, that's my little blurb. I don't need to say anything else. There are two books. If you want more information on this, you want to do the IC cookbook, IC Chef Cookbook. Let's see. Where is it? Where is my other book? The IC Chef Cookbook would be a great place for you to start. You can buy it as a PDF file and get it right away. And one of the things that the IC Chef Cookbook has in it, but it's also free on our website, is the 3-column diet list, which we are in the process of redoing. Let's see, where is it? Where is it? Come on, I literally edited this book. Oh, here it is. So if you haven't seen this food list before, it has 3 columns, usually bladder friendly, foods we're trying, and foods to avoid. And it's 13 pages long. And the reason why we did this book, again, was for people who were just not eating enough. And we wanted to show you the depth and breadth of the things that you could eat. All right. So if you're really struggling and you just don't know, come on over to our website, icnetwork.org. Go to the diet section. It's very big. And you can look at those food lists. You can look at the research list. You can look at our much longer list. You can read a lot of articles by Bev Lauman. called Fresh Taste by Bev. She's the author of A Taste of the Good Life, a cookbook for the IC diet, which is no longer available, but with the articles that she wrote for us are fantastic. They're so, so good. Like cinnamon. She has an article called Cinnamon's True or False, that there are some forms of cinnamon that really can be more irritating than others. Fascinating. That woman is amazing. All right, so let's go to your questions here. Ellen says you Ellen says you are amazing. Thank you, Ellen. I appreciate that. It's good for my ego. Hold on, I got to move this a little bit. Thanks for the recommendation. I love Dandy Blend. Dandy Blend is an herbal. This is a Dandy Blend Frappuccino. So Dandy Blend is an herbal coffee that's made with roasted chicory and dandelion root and a couple of other things. And this is what I drink every day. I usually do 3 of these. I just love Frappuccinos. But I can't do Starbucks anymore because it messes my heart up badly now. I am forbidden from doing any coffee, even decaf. Not for my bladder, because again, my bladder's pretty healthy now. It's because of my heart. I'm IC subtype 5, central sensitization. That's common. Ellen says she also loves Bladder Builder, which is one of the new supplements that's been out for a couple of years. Bladder Builder is the only supplement that has PEA in it that can also reduce pain, as well as help the bladder wall. Well, there's 2 supplements. It's Allopath too. Shell says, just had to start going to a new urologist. He says, I've done everything that there is out there with little to no improvement. I have a complicated UTI, 3 years now. He says I have to see an infectious disease specialist, really hoping they can get the infection under control. Then maybe treatments for IC might work. Shell, I completely agree with your doctor. You absolutely need to be with a infectious disease specialist at this point in time. You know, I don't know if you guys have heard the term superbug. Superbugs are bacteria that are resistant to many antibiotics. And we had a superbug out of China about 5 years ago that is extremely alarming because it was resistant to every known antibiotic. And so what happened is the people in this little town outside this giant pork farm in China started getting this infection. And it wasn't treatable, and some survived and some died. And it pretty much scared the hell out of everybody. Well, then it was found in Europe. And again, it was the same multi-drug resistant E. coli. E. coli is really can be a very vicious infection. And again, bam, it was an issue. And then about 4 years ago, 5 years ago, it might be a little bit longer ago, a woman back east got a bladder infection. And it was this super resistant superbug, E. coli. And so they asked her, have you traveled? She said, no. Had she been exposed to anybody who traveled? No. And unfortunately, they then did a little bit more research and they found it in some large pig farms. You have to understand that the great majority of antibiotics, the millions of pounds of antibiotics that are made, are given to animals more than people. Animals are the biggest consumers of antibiotics because they keep them in these big farms very close together where disease is rampant. So to prevent those diseases, they throw antibiotics on them. But it becomes an antibiotic drug factory. And so unfortunately, this now superbug was found, I think, in a couple of pork producers on the East Coast. And so, Shell, maybe it's possible that you picked up that superbug. Ideally, that infectious disease specialist will do some pretty aggressive next generation DNA urine testing so that they can look at your biome. They need to look at the bacteria that they find, but they also need to look at the fungus they find and also virus, because the other thing too is it really could be a viral infection. A typical urine test will not identify virus or fungus. So now, man, all bets are off. They got to start at the beginning, preferably with the next generation DNA urine test, which will allow them to look at every single thing living in your urinary tract. And I wish you the best. I'd love to talk to you after you go or before you go. If you want to try to prep for that appointment, I'd be happy to help you with that. Anne says, can you have overactive bladder with IC? Well, so overactive bladder, the way you differentiate IC and overactive bladder is through the symptom of urgency. So if you're running to the restroom because you're worried you're going to wet your pants and leak, that's overactive bladder. If you're running to the restroom to relieve pain, that's IC. That says that there's something wrong with your bladder wall. Okay. So, you're going to have frequency, urgency with either condition. Overactive bladder patients also usually don't have pain. They just have the frequency, urgency. Jill says, I have constant IC. It never goes into remission. It can flare, but it is ever not in 30 years without symptoms. Okay. So hold on a sec. I got to go grab something. I'll be right back. Hold on. And let me grab this to stay. Okay, now listen, guys. Listen. This Linda is so important here. She says, Jill is so important here. Another Jill. It's always nice to meet other Jills since I'm a Jill too. I have constant IC. It never goes into remission. It can flare, but it is never, ever not in 30 years without symptoms. Okay. So if bladder therapies don't work for you, then maybe it's not your bladder. And this is the reality. Guys, this is the reality. This is what we're seeing. We're seeing patients who've been told that they've had IC for 10, 20, 30 years, but they never get better on bladder therapies. Why? Because it might be, and it probably is, something outside of their bladder that is causing the symptoms. Remember, the symptoms are the effect. Now we have got to focus on the cause. So Jill, to kind of reformat your question, what you have is you have constant frequency, urgency, pressure, pain. So we've now got to figure out what the hell is causing your frequency, urgency, pressure, pain. And what the AUA says is stop what you're doing, take a step back, revisit the diagnosis. So the first thing we want to know, Jill, is what the hell's going on with your muscles, if anything. Because if you've got tight pelvic floor muscles, that could be it. If you've got a tailbone healed out of position that's tweaking your muscles, that could be it. If you have a bad hip, a bad knee, a bad foot that's always leaving your pelvic floor muscles tense, that could explain it. Could you have a Tarlov cyst coming off of your spinal cord? That could explain it. Do you have an estrogen problem? That could explain it. Do you have a rheumatic disease? That could explain it. So there are 2 books that you need to do a deep dive into because we want you to get better. The first one is our new one, IC 101. It's not just a bladder disease. Because this is the first book to really talk about subtypes, because we got to figure out what your subtype is. We have to try to figure out cause versus effect, right? So this would be a really, really good place for you to start. And you can get it on our website as a PDF file. It should be on Amazon soon, right? But the other book that is free on Kindle Unlimited is this book, Facing Pelvic Pain. This is the book you and I needed 30 years ago, because this is the book that goes through every other condition that could cause these symptoms and mimic IC. This is literally a fantastic contribution to the IC world that came out earlier this year. And created by urologists at Harvard Medical School. They invited specialists around the country to contribute to different chapters. And I was very blessed to have been asked to contribute the chapter on IC support. And so Facing Pelvic Pain, and it's a guide for patients and their families, and it's free on Kindle Unlimited. For God's sake, get it and read it. We got to figure it out. I don't want you to suffer for another 30 years. So there are chapters on which musculoskeletal problems can lead to pelvic pain, which gastrointestinal problems can lead to pain, which urogenital problems can lead to pain. It talks about male anatomy, female anatomy, surgery, all that sort of stuff. It has a huge chapter on medication use for pelvic pain, et cetera, et cetera. What rheumatologic, neuroinflammatory, and vascular conditions can cause pelvic pain. So, girl, listen, you are an anatomical mystery to be solved. And at this point in time, it has not been solved. It is time to take a step back. Let's look at all those potential causes and see if we can narrow it down a little bit more. Facing Pelvic Pain. And it's by Elise Day and Thomas Stern. They're the editors of this book, and they're from Harvard and Massachusetts General, okay? So everybody out there, seriously, if you can't figure it out, if your doctors can't figure it out, you just do not understand why you are struggling to the degree that you are. It's free. Seriously. There's no excuses. Get it. It's on Kindle Unlimited. It's free. And go through some of those chapters. And maybe that will open some new doors. I want to tell the story of a Facebook patient with quote unquote IC. She'd been diagnosed with IC, been on IC meds 20 years, never got better. Never got better. She attended one of these meetings. And one of the things that I usually say is, okay, if you're not responding to treatment, take a step back. Okay, that's important. But the other thing that's really a critical point is, do you have pain in one location that never goes away? One location that never goes away, to the left or to the right. And in her case, whenever they did pelvic floor physical therapy, it hurt like a beast. I mean, it really hurt her. Like, it was surprising. Pelvic floor physical therapy, after a couple of weeks or a couple of attempts, you usually feel better. She didn't feel better. She felt worse. She felt much worse. And so what they did is they did an X-ray or a CAT scan. And you know what they found? She had a giant growth in her pelvic floor muscles. It was benign, but it was in exactly that location. Bladder therapies, all the bladder therapies she was on, completely wasted. Completely wasted. And as soon as they told her where it was, she goes, oh my God, I know exactly when that happened. She'd fallen off a horse. Another IC patient I worked with who was not an IC patient. She had urethral pain, terrible urethral pain. I did several doctors over time. Nobody fixed it. None of the bladder therapies worked. None of them worked. And finally, she kept saying to this one to this one new provider, but it's in my urethra. I don't understand why it's in my urethra. And the provider went, well, let's do an X-ray. Let's take a look. Or whatever imaging they did at the time. You know what they found? She had a urethral diverticulum. So your urethra is like the size of your little finger, okay? She had two. The regular one, and then there was a little tiny tube that connected to another structure that was the same length as her urethra. It was a diverticulum. Diverticulums happen often with straining, right? It's just the tissue, you push so hard, the tissue has to go somewhere. And so she had a regular urethra, and then she had a second structure that was holding urine and was very, very painful because once a fluid gets in there, it's hard for it to get out. They found it, they removed it, cured. So, man, you got to be the squeaky wheel here. Don't you dare give up. You keep asking, but your ability to talk about your symptoms is really important here. Like in her case, she kept saying, listen, it's my urethra. It's my urethra. It's my urethra. It's my urethra. If somebody finally listened to her and went, okay, let's do an x-ray, and they found the diverticulum. Linda says, I've been using Elmeron with success for 30 years. A week ago, I had a flare that even my meds would not help. I don't know what to do now. So Linda, I'm sure that you're aware now that of all the research with Elmeron and eye disease. And so it's very, very important that you get your eyes checked, because if you're showing any changes in your retina, that is probably from the Elmeron, and they're going to want you to make a change. So you now are having a flare. And our job now is to try to figure out what kind of flare you're having. Is it a bladder wall flare? And the bladder wall flare can happen because of some sort of chemical exposure, or because you screwed up with your diet, or it could just be that you've gotten older and you're now at that point where your estrogen levels have dropped enough that your bladder wall is more vulnerable. And the foods you ate last week, literally, you can't eat this week because they're going to be more irritating. But the other question is, could it be a pelvic floor flare? That's a possibility. So pelvic floor flares happen after sex. They happen after long car rides, sitting for a long period of time. So we're going to be doing muscle relaxation things for patients with pelvic floor flares. Or could it be infection, right? It's possible it could be infection. And guys, remember with COVID, we've been doing the IC COVID research. Patients, IC patients who get COVID, 75% of them report that their IC symptoms get worse, and 25% report it's a worst flare of their life, and they flare for a couple of months. And that's because we think that the COVID virus is infecting their bladder wall. Why do I say that? Because we have research studies that have found live virus in kidneys, infecting the kidneys, but we also have had 12 studies that have found live virus in urine. So it's not that much of a stretch to think that COVID could be in the bladder wall also. Now, you guys, for any of you who have any weird, you just don't know, you don't know where to start, if you want to, you're welcome to call me. You can call the IC Network. I mean, I answer the phones Tuesday through Friday. Monday's my day off, unless you call in the late afternoon. And I'd be happy to talk to you, no charge. But if you want to do a deep dive and talk for like an hour longer, I might have you sign up for a coaching session. All right. So Ellen says, I'm tapering off Elmeron and is using Bladder Builder to kind of do a reverse titration where if you were doing like 3 Elmeron a day, what Dr. Parsons said is go to 2 a day, and then you would add 1 supplement a day, and then you do 1 Elmeron and then 2 supplements, and then no Elmeron and 3 supplements. That was a protocol that they suggested at the 2006 San Diego IC conference. And that was done, that discussion was within the context of switching from Elmeron to Cysto Protec. So we use that same protocol for the other supplements too. Anne says, what is pudendal neuralgia? Pudendal neuralgia means that the pudendal nerve, which is the dominant nerve in your pelvis, is somehow compromised. So these are the patients who have positional symptoms. You're fine when you stand, but when you sit down, it hurts. Or when you bend over, it hurts. Or you might have pins and needles. Or you might have numbness. Or you might have persistent genital arousal disorder where you have this painful arousal sensation that hurts a bit. All right, now you guys on YouTube, thank you for being so patient with me. Let me come take some questions on YouTube, and then I will come back to Facebook. Oh, my mouse is working again. Oh my God. Yay, my Apple mouse is working again on my other computer. Woohoo! All right. Nicole said, so here, hold it here on YouTube real quick. Becky wants to know, does anybody use testosterone cream? That's not commonly used in the IC world. I can't help you with that at all. Becky says she loves getting our magazine. Awesome. I love doing our magazine. And we've got a lot of good writers who contribute to that now. Rhonda says, my gastroparesis is back. It's such an awful thing to have. No one knows unless they go through it. I had a 4-hour test. I have slow emptying. Yeah, girl, I have gastroparesis too. One of the best things you can do with gastroparesis is just do a search for on the internet for gastroparesis diet protocols. And that's what I did. And I found a protocol for somebody with extremely severe gastroparesis, which I didn't have. I had very, very mild gastroparesis, but it helped me understand the types of things you might need to avoid if you have delayed stomach emptying. And for me, it is leafy green vegetables. Gastroparesis means food sits in your stomach for a long period of time and it starts to ferment. And so you get very gassy. You belch a lot, and you can get so much gas that it really, really hurts. And so when you have gastroparesis, the dietary protocol is to eat foods that are easy to digest, that will not sit in there for a longer period of time. And the foods that are actually kind of the hardest for us to digest are leafy greens. And I will tell you that I do, once I stopped eating lettuce and spinach, my gastroparesis virtually disappeared. And so take a look at some of that diet information and see if something similar might help you, Rhonda. I feel your pain, girl. I feel your pain. Nicole says, "Hi everybody. I use the Bluebonnet brand of buffered vitamin C. It's in powder form. The vitamin C and calcium." Okay, cool. Good to hear. Thank you. Sierra says, "I had pelvic floor therapy this week. When I cough, pee still comes out." Girl, Sierra, you've done physical therapy once. This is about improving your muscle tone over time. So that's going to be your measure of are you improving? It's going to be your stress incontinence, but do not expect miracles with one therapy. You got to stick to it. Your muscles have been dysfunctional for years. One physical therapy appointment is not going to fix it. This is about developing a long-term system that will help, long-term muscle health that will help. Kath says, "Jill, I have a question about IC and COVID vaccine. Is there any studies about that?" Not that I'm aware of. I think our study is the only one that we've done that's been done so far. That's about patients who get IC and COVID. I know Dr. Theo Harides at Tufts University is planning to do some paper on it with a couple of other doctors. So I sent him all of our data so that he would know what our data found. I'm going to say from all of the meetings that we've done, I think that 90% of IC patients, 85 to 90% of IC patients who have a COVID vaccine, they're fine. They're absolutely fine. But about 10% do flare afterwards. And I don't understand why. I don't understand the mechanism. And so you have to really think about risk versus benefit. But more importantly, which is worse, having the vaccine or instead having active COVID. The Delta variant, guys, is nothing to laugh about. The Delta variant is devastating, but the new Lambda variant out of Brazil is far worse. And so it is incredibly important that we try to stop this. We have to stop these large populations of people getting COVID because that's where viruses mutate. And we are in danger of more mutations happening. And we could have a mutation happening that defeats the vaccine. So we've all got to work together to bring it all down. It's at this point in time, it's a public health crisis. All right, hold on a sec. I have to plug in my keyboard. Now it says my keyboard is getting low in battery. My goodness gracious. Sierra says, "I had more than one pelvic floor therapy. I was in therapy for 6 months." Oh, Sierra, I apologize. I didn't realize that. Well, I guess the question is, are you better or worse? Did the physical therapy help at all? If it didn't, then I think this is going to be a visit to your urologist to try to figure out if there's some sort of neurological issue that is also driving your incontinence to a certain perspective. All right, let's come back to Facebook here. Vera says, "Why does my pain worsen when you lay down?" That's because when you're laying down, that kind of puts you right into potentially the IC subtype 4, pudendal neuralgia subtype, because your symptoms are positional. You're fine when you stand, but when you lay down, your symptoms get worse. So muscles are now in a different position. Gravity is now pushing in different areas. And so it may be that you've got a bit of a compromised nerve. I have a slight pudendal neuralgia on my left side. It's a nerve that's about an inch or an inch and a half to the left of my rectum or my tailbone. And I will tell you that I too do not do well laying on my back because it will trigger that little off branch. See, normally, so here's your pelvis, right? So your nerves generally kind of go in and down the legs, but they're like they have different branches. They kind of go all over the place. And there's one branch of the pudendal nerve that actually comes off of it and goes backwards. It's a little loop back. And that's the branch of mine that is slightly compromised. Ashley says, is there any cold and cough and cold medicine that's IC friendly? Ashley, if you go over to our website, icnetwork.org, I have a whole section in there on IC friendly cough and cold medicines and what worked for us. We've done a lot of surveys of IC patients. I will tell you that the honey supplements are absolutely the most popular by far. At Ricolas work particularly well. And then quite a few patients love the traditional medicinals teas. And hold on, let me see if I've got them here. Every time I survey our members about what are your best IC-friendly cold and flu strats, these always come up. Or traditional medicinals Breathe Easy and traditional medicinals Throat Coat. The Throat Coat has licorice root, slippery elm, marshmallow root with fennel, cinnamon, and a little bit of orange peel. Don't worry so much about the orange peel. That's not particularly acidic. But a number of IC patients say that this is their go-to when they need to drink something, ideally with honey, because the honey is also has a nice soothing effect combined with also attacking potentially bacteria, etc. And then, of course, Breathe Easy. And let's see what's in the Breathe Easy. Fennel, licorice root, eucalyptus, peppermint, and ginger. You just have to understand that licorice root, you have to be careful with licorice over time. Because it does lower your potassium levels, and that's dangerous. So little bits here and there. There you go. But anyway, come on over to our website, icnetwork.org, and you can search over there and read the whole article on it. For those of you who are members, you can go back, look at your back issues. I think the last time I did it was a year ago, and you can look at the latest research then. Shannon says, I can do wine and coffee, but stress is my flare-up, and chocolate and soda. Well, that's a challenge. That's a challenge. If you're going to do wine, you got to do a low-acid wine, like a Chardonnay or Merlot. And hopefully you don't have a histamine reaction from the red wine. The coffee, you got to be careful of. I mean, if you're going to do coffee, it needs to be a decaf low-acid coffee. That's going to be the least traumatic to your bladder. And so the low acid coffees that we recommend are Simpatico low acid coffee. This has been out for years. So quite a few patients can do this one just fine. There's decaf and regular, but of course we recommend decaf. Tyler's, he calls it a no acid coffee. That's not, no. When you pH test it, there's a little, it's not pH 7. It's in the pH 6 range, which means it does have a little tiny bit of acid, but it's very, very low. So the Tyler's organic coffees, there's decaf, there's regular, and there's K-cups. But the one that I absolutely think is the best one on the market is called Bella Rosa, because Bella Rosa has the lowest levels of the specific acid that develops that can be irritating. So this is the best in the country, in my opinion. And then I got a note here on a Post-it, Volcanica has a low acid coffee. I gotta explore a little bit. All right, Deborah said, I recently had a hydrodistension, 5 weeks out, I'm in pain, had a bladder infection afterward. The infection is gone, but I still have pain. Could the procedure have ruined the coating that Elmeron has built up over time? The Elmeron does not leave a permanent coating in your bladder. Elmeron is a small molecule that can and will eventually be washed out. That's why they have you take Elmeron every day to replenish the Elmeron that kind of washes out. So the therapy, is the hydrodistension going to wash all the Elmeron out? That's a good question. I mean, normally they do it under pressure, and so they fill the bladder up with fluid under pressure. I hadn't really thought of that before. Possibly. Um, but could the bladder have been injured during the procedure? Absolutely. That's very common. The worst thing you can do to any hollow organ in your body, whether it be your bladder or your stomach, is to blow it up. So hydrodistensions, they use a fluid to distend and stretch the bladder. That's why people usually feel worse after they have a hydrodistension. The challenge here has been 5 weeks, hon. Normally, that hydrodistension pain is gone within a week. The fact that you're having persisting pain 5 weeks later is concerning to me. I think I would be doing a couple of things. I think that I would ask my doctor for another urine test because you did have a post-op infection. Let's make sure it's not still there because that happens. The infection may have gone quiet and maybe now the infection is active again. So I would want them to test for infection again. And then if that comes back negative, now remember they had you on antibiotics for a bacterial infection. The side effect of antibiotic use is fungal infection. So I would also have to wonder if there's any chance that you now have a candida infection in your bladder because of the antibiotics that they had you use. So a next generation DNA urine test might be really meaningful for you. You ask, could the bladder have been injured? You would know if your bladder was injured because you would be peeing blood afterwards. So have bladders been injured because of hydrodistension? Yes. That is why the American Urology Association only recommends low pressure hydrodistensions. Back in the old days, they used to do high pressure and the bladder would rupture. It would just basically pop. And so if you came home from the hospital with a indwelling catheter and you had to have a catheter in there for a week, your bladder was injured. If you're peeing blood afterwards, blood clots, your bladder was injured. But that heals too. And so 5 weeks later is challenging here, hon, Deborah. I hope that you're maybe also looking at something that could coat your bladder. You could ask your doctor if they would do some rescue installations. Maybe that would work. Some heparin lidocaine installations might break you out of that flare that hydrodistension may have caused. That would be the next step, would be the rescue installations, I think. Marie says, even if you do low acid coffee, caffeine free, it's still not good. Listen, if you had a wound on your hand, would you pour decaf coffee on it? No. That's why, you have to, every IC patient at some point in time has got to go off all of it for a good 6 weeks, 8 weeks, give your bladder an opportunity to heal because it just doesn't make sense to pour all the chemicals found in black coffee into a wound. Hi, Boria. Mary says, anytime I eat, and it doesn't matter what it is, my stomach feels heavy. I feel bloated and tight. I do a lot of plain baked chicken and baked potato and water. Mary, you kind of describe what we call as gastroparesis. And so the question is, are you belching? If you're belching and you feel like you've got gas on your stomach, you need to talk to a gastroenterologist about it, or at least Google it. Google gastroparesis and see and look at those symptoms because you may have that. Michelle says, I'm super new to the group in the ICU world. I just got the diagnostics on Friday, still in tremendous pain. What should I eat? Okay, so Michelle, please go to our website, icnetwork.org, rated #1 in the world by Harvard Medical School and the University of London. I need you to look at the subtyping information because not everybody has the same form of IC. There's a lot of diversity in this patient population, and you can find all the diet information right on our website, okay? And if you need help, you can call the IC Network patient support line. And guess what? I answer the phone. I answer that phone line. The challenge is first come, first serve. So, for the patients who've called in the morning and left messages, there might be 4 or 5 a day. I'm going to be calling you guys back. Sometimes I call very late. Pamela says, my family doctor tells me hormones have nothing to do with pelvic floor or vulvodynia. My gums are swollen. I eat broccoli all the time. My family doctor tells me hormones have nothing to do with the pelvic floor. It's ridiculous. Absolutely ridiculous. And Pamela, again, this book I think would be very helpful for you. This would be very helpful for you. And the other thing you need to do is you need to Google genitourinary syndrome of menopause, GSM, and look at those symptoms. Ellen says, I just bought the Bladder Smart vitamin. It says for better absorption to take it with fat. Can you give a little more information on that? Well, fats help absorption. And but it's not mandatory. I never take my Bladder Smart with a fat. I take my Bladder Smart before I go to bed. That's something that they put on all of their supplements, that it's good to take it with a portion of a healthy fat, like a couple of almonds, a little bit of olive oil, something like that. Ingrid said, I have a question. I just got my knee rebuilt. Would that have have anything to do with the way I'm trying to heal? Absolutely. Absolutely. Knee replacement is going to change the way you walk, which is going to then affect your pelvic floor. So you're probably going to be having some pelvic floor pain while you're going through that. So remember, here's your pelvis, right? And as you walk, your hip bones normally work together. But if you've got one leg shorter than the other, or you're limping, this is going to put stresses on your pelvic floor, and it's going to become much more tense and sensitive. Judy says, what is the difference between Claritin and hydroxyzine? Claritin is over the counter. Hydroxyzine is a prescription. Hydroxyzine, in research studies, they believe that it is the most effective at reducing mast cell activity, histamine activity in the bladder. And so hydroxyzine is generally what is recommended for patients. But if insurance doesn't cover it, then they might send you to an over-the-counter antihistamine like Claritin. Ingrid said, just wanted to know because I'm really having a hard time and I have a lot of scar tissue that's built up. Okay. Elizabeth says, I saw you had a video a while back about pinpoint bleeds in IC. I would love if you could post a video of pinpoint bleeds in the bladder so I could show it. Elizabeth, they're all on our website. Go over to icnetwork.org and you can find those videos right on our website. You can find the Hunter's lesion video and you can find the pinpoint hemorrhaging. For people who don't know what she's talking about, pinpoint hemorrhaging is not considered important anymore. It's not. Pinpoint hemorrhaging has been thrown out. It's been thrown out as a requirement for a diagnosis of IC. So let me show you a couple of pictures here. So this is an example of pinpoint hemorrhaging pinpoint bleeding in your bladder. We also call this glomurulation, so that you can see, if we get up close, see the little red spots? Lots of little red spots. Okay, now that's very different from a Hunter's lesion. So a Hunter's lesion has a big red center area, and it usually has red arms that go off of it. Well, that's a really bad one right there. See this one right here? You can see the red arms. Facebook, I'm not sure if I'm holding it high enough for you guys to see it because you're on a different camera. Okay, so you can see these are very, very different. Very, very different. So the consensus now is that this might be happening because of the test. That when you stretch the bladder, things break. You're stretching it. I mean, if you hold too much stomach, too much air in your mouth, your skin starts to hurt, right? If you eat too much and your stomach stretches, it really starts to hurt and the tissue starts to rip. So we had a researcher, I'm going to say like around 1990, who after a diagnostic criteria was released requiring this, we had a researcher say, not so fast. This could be a residue of the test. And so they took 50 women with normal bladders, no bladder symptoms, scheduled for a tubal ligation and did a hydrodistension on them. And this happened in every single one of them. So this is now considered a legacy of the hydrodistension. And so last summer, I think it was Dr. Phil Hanno, I think it was him, in a presentation, basically said that this is considered meaningless at this point in time. We don't see any value in the finding of petechial hemorrhaging on the bladder. So the pinpoint bleeding, happens when your bladder is being stretched. But anyway, Elizabeth, you can find those videos right on our website. Mindy says, how do you find out what subtype you have? Well, hon, believe it or not, you can do it. You have to understand that the great majority of doctors out there are doctors that don't go to conferences and they don't read the journal articles and they don't necessarily they don't even know what the subtypes are. I just, in the editorial of our summer magazine, gave the latest, where is it? Gave the latest article that came out, again, from Dr. Phil Hanno, who is the top urologist in the country from a research/National Institutes of Health standpoint. He's kind of a gatekeeper for IC research and credibility. So he and some authors issued a paper, I think 2 or 3 months ago, in which they just flat out admit that we can't have variety in this patient population in the same research study. You can't put a patient with Hunner's lesions and a patient with pudendal neuralgia or a central sensitization in the same research study because they're different. They're going to respond differently to new therapies. There's no doubt about that. And so they are of the agreement that at a minimum, a research study should have 2 groups, bladder-centric and beyond bladder. That the bladder-centric patients are going to be the Hunner's lesions, bladder wall. Beyond bladder is going to be the pelvic floor, pudendal neuralgia, and the central sensitization. That we should at least make sure that those are not included in the same research study. Christy says, medical marijuana and marshmallow root have been a godsend for me. Been in remission since moving to a legal state. Awesome. Marshmallow root, definitely calming and soothing to the bladder. Medical marijuana certainly has helped a number of patients. Jessica says, for IC, is lysine C better or super lysine? Lysine has nothing to do with vitamin C. Lysine is really something that you can do if you are struggling with viral infections. So there's a product called super lysine. They make chapsticks and things like that. If you get canker sores, herpes sores like I do, then lysine is viable. It interferes with viral replication and it slows viral infections down. And so I personally like the super lysine products. Those are the ones that I use, Jessica. So Getting back to Mindy about how do you find it out? Well, we really want to look at the symptoms. So Hunner's lesions are going to be severe pain, blood in your urine, extremely dietary limited, and a doctor has at some point in time looked in your bladder and said, yes, you have lesions on your bladder. Bladder wall driven is generally pain as your bladder fills with urine that is relieved by urination, but that also applies to Hunner's lesions. Pain after urination, it points us to pelvic floor. If you can't start your urine stream right away, if you're hesitating 5, 10, 15 seconds before you can relax enough to release urine, that tells us that your muscles are tight. If you've got persistent genital arousal disorder, pins and needles, positional pain, that's pudendal neuralgia. Then if you have super, super, super sensitive skin, a wicked sense of smell, you've got IC, IBS, vulvodynia, TMJ, migraines, things like that. That's IC subtype 5, chronic overlapping pain conditions. You read about all those right over on our website. Karen says, how many folks have remained on Elmeron? I don't know, hun. That's a really good question. The great majority of patients that I work with have called and they have gotten off of Elmeron. I think Elmeron's pretty dead in the water, to be quite honest. And I know I'm probably upsetting a couple of people by saying that, but, you know, it wasn't patients who came forward and said, hey, Elmeron hurt my eyes. It was retinal specialists at the Emory Eye Institute, now supported by retinal specialists at Harvard and retinal specialists in California. Man, they're finding changes in the retina in patients who use Elmeron. So it's not like anybody's making that up. The data's firm. I think I even have. Yeah, look, I can even show you pictures. I reorganized my files here. If you want to see what Elmeron can do to the retina, so this is from the very first paper that the Emory Eye researchers wrote 3 years ago. Pigmentary maculopathy associated with chronic exposure to pentose and polysulfate, also known as Elmeron. So these are different types of scans of retinas over time. So the ones here are the early scans, so you can see some clear differences here. And then this was a period of time later. You can see the damage got significantly worse. And then again, later, the damage got more worse and more worse. Definitely considered progressive. And it was a ophthalmologist at Harvard who is the first to discover that the damage continues even after you stop using Elmeron. Oh, look, there's my next gen test. What's that doing in my eye folder? There's another medication which does the same thing. It's called Plaquenil. Let me see. Here's another picture of some of the changes in the retina with Elmeron use. And I think that this is probably, if you look at this picture, this is a three-dimensional picture of the retina. And you can see these spots. That's actually the retinal cells that have been changed by Elmeron. So anyway, if you want me to go in depth into that, I would be more than happy to do that. Monica says, I only had pain during that time of the month, specifically the first 2 days. So I guess my pain is possibly hormone. Yes, yes. When your estrogen levels are low, your bladder is more sensitive. It is what it is. You might notice a flare the day that you ovulate and a flare a day or two of your period. Sue says, it's so weird. I had the vaccine, Moderna, March 13th, got COVID July 21st. Well, I had it, I had no icy symptoms, no icy pain. Your symptoms were gone for 2 weeks, but as I'm healing from COVID, you're having an icy flare. It was the first relief I've had in so long. Sue, I think that that's a really good example of distraction. Your brain prioritizes the messages that it uses to take action. And so, if you were coughing, having trouble breathing, stuff like that, your brain is going to focus on the things that are life threatening first, and you're literally not going to sense your bladder during periods like that. It would be much less likely for you to feel that. Two of you, Ingrid and Elizabeth, both report you've had infections after hydro distension. That's extremely common. Anytime you put an instrument into the body, you have the potential of introducing bacteria into the body. Hello, Lisa from Texas. Marie says, if you do have a fungal infection, what should you do then? I have kidney stones and they love to give you antibiotics, but you had to stop because I was told I had IC. So the challenge, Marie, you're, here, I have a picture. I swear I have a picture for everything these days. So the challenge with kidney stones, hon, is it's not like they're little round stones. They're jagged. So this is an example of a bladder stone. You see? So it's minerals that are growing in lots of different directions with very, very sharp edges. So when they look at kidney stones, they are covered with bacteria, lots of different types of bacteria on kidney stones. So here you have a sharp stone in your bladder. It's coming down your ureter into your bladder. And if you're lucky and it's small enough, it will pass through your urethra. But along the way, that stone is actually rubbing against tissue and even potentially cutting tissue. And as it does that, it's introducing bacteria directly into the tissue. So you are in a challenging situation because stones are exquisitely painful and they certainly can cause infection. So I guess the question now is, did they tell you that you never had stones and it's IC, or they tell you now that you have IC and stones? Sharon says her bladder split with a hydrodistension. Rebecca said, I've tried 3 different kinds of estrogen. My bladder has been bad for 8 months straight. Is there a test that will see what hormones will help? No, you're going to have to work with your gynecologist on that. Ingrid, who had her knee replaced, she says, I can't bend my knee. It hurts really bad. Thank you so much, Jill. I've been so upset about all this. I can't bend my right knee at all and have a lot of scar tissue. So that's awful, Ingrid. Wow. Guys, of all the joint replacements, the most painful joint replacement is the knee replacement. But normally they would have you up and walking and in physical therapy immediately, like literally the next day after knee replacement. And with movement, normally that heal. It sounds like you can't bend your knee at all. Are they saying that's because you have scar tissue, or did they make a mistake? I mean, it's metal. You're saying the metal won't bend? Wendy says, can IC cause inflammation in your blood work? I don't know. I know that a lot of people like to say that IC is an inflammatory condition, but we never meet the markers on blood work to prove that it's an inflammatory condition. I think that there are 4 markers that they look for, and again, we have diversity in this patient population. Some of you have a central nervous system issue. Could some patients have an autoimmune issue? Absolutely. But it's not everybody. It's just a small group of patients. Denise said, amazing. I have 2 Tarlov cysts on my spine with numerous other back issues. Maybe this could be my recent flare. Feeling better now, though the last flare was 5 years ago. Yeah. My gynecologist told me to try the Goli gummies. Now I'm in remission. What the hell is a Goli gummy? Let's look it up. A Goli, Goligumm. Oh, you mean an apple cider vinegar? Hmm. Well, apple cider vinegar is, even though it's strongly acidic, it becomes immediately alkaline as soon as it's in your mouth and starts to get processed. That said, the challenge with this one is it does have citric acid in it. So patients with Hunner's lesions, they would have a hard time tolerating this gummy. But I'm glad that it's working for you. That's awesome. You guys are talking about the diet app. That's my app. I built that diet app. It needs to be updated. Haven't done it yet. Hi, David. Marie says, I have both IC and stones, but you said you can get a fungal infection with an antibiotic, or did I miss? No, you absolutely can. So, honey, Marie, you are in a challenging situation here. I mean, there's no doubt that you apparently had UTI, which comes with stones. The treatment for the UTI kills all the bacteria in there, including the bacteria which normally keep the fungus in check. And so now that's why candida infections are a risk factor of long-term antibiotics. And so, you're kind of damned if you do, damned if you don't. You need the antibiotics to deal with the kidney stone induced infections, but normally they would have you on probiotics or something like that so that you can try to replenish the good bacteria so that the fungus doesn't grow amok, running amok. All right. All righty. All righty. Sierra says, do men get pelvic floor issues? Absolutely. And in fact, the majority of men that we work with have existing pelvic floor injuries, Sierra. Let's see. Graciela says, what else can I take besides Elmeron? Well, there's no other FDA-approved oral medication that has the same coating effect that Elmeron does. And so you're going to look instead for supplements that contain chondroitin. The supplements that contain chondroitin are believed to have a similar effect. So that's going to be the top supplements are Bladder Builder, Bladder Rest, Cysto Protect, or Cysto Mend. Those are the top 4 chondroitin supplements. So let's see. Let me Bladder Rest. And I don't have a Cysto Mend bottle. I gave away my last Cysto Mend bottle. So anyway, so it's going to be Bladder Builder, Bladder Rest. This is the new Cysto Protect bottles, guys. So the old Cysto Protect bottles had this label. So the old bottles had the turquoise label. These are no longer in production, so don't get confused by that. The new bottles of Cysto Protect are white and yellow. The pills right now are red, but they are going to be brown by the end of the year. They will be going back to the carob covering instead of the annatto coloring. All right. So a lot of people say, well, which one should I do? And the answer is, well, it's really kind of about your sensitivity. I personally think that the supplement that has the most methods of action and appears to be the most robust is Bladder Builder, because it has the chondroitin, it has the quercetin, it's got beneficial probiotics in it, but most importantly, it has PEA in it for pain relief. And so for patients who are struggling with a lot of pain and discomfort, this is the one that we generally suggest first. If you are uber sensitive and you flare when you do a probiotic, then that's not the one for you. For patients who are super sensitive, this formula is really kind of clean and pristine. And it's in an avocado base for people who have problems with shellfish. So this would be that one. If you're okay with shellfish, the tried and true supplement is Cystoprotect. And again, chondroitin, hyaluronate, quercetin, and an olive oil base. So this has been around for 28 years now. No, 25 years, 23 years. So Bladder Builder, Bladder Rest, Cystoprotect, or the other newer one is Cystomend, which is like Cystoprotect, but about 50% stronger. So Cystomend is a viable option too. Rhonda says she's positive for ANA, anti-nuclear antibodies. All right, then you definitely have some inflammatory stuff going on. Not everybody does though, hun. So we can't say everybody has that, but some do. So if you got Sjogren's, lupus, stuff like that, then yeah, you've got some immune issues going on. Graciela says, I'm premenopausal. Why is my pain all day? Hold on. Why is my pain all day for 6 months? When it gets bad, you're in bed half of the day. Otherwise, I feel pressure. You know, pressure is the difficult symptom to understand. Rhonda, hold that thought. I will come right back because I just did an article on lupus cystitis and a treatment for that. Okay, but let's go back to Graciela, who is premenopausal. She has been in pain for 6 months, and she has to be in bed half of the day. Otherwise, she feels pressure. What could be going on? So, Graciela, again, we kind of have these 5 subtypes here, and we have to figure out what could be causing your pain. So, subtype number 1, Hunner's lesions. So, has anybody ever looked in your bladder and told you have lesions in your bladder? Because that's certainly untreated lesions are literally the most common cause of severe bladder pain in the IC patient population. So is there anything going on with your bladder wall like Hunner's lesions? The second thing that we would really want to know is, what is the health of your skin? Because you are perimenopausal or premenopause. So as your estrogen levels decline over time, your skin gets drier. So if your vulva is dry and your vagina is dry, then so is your urethra, so is your bladder, and so is your mouth. These are our 5 mucous membrane organs in women. And the lower the estrogen, the drier they become, the less able they are to defend the tissue that normally does. Remember, the bladder is the only organ in the human body designed to hold toxic waste, because urine is body waste. It contains ammonia, urea, and all sorts of crap. So how does the bladder defend itself against all these harsh, irritating chemicals in urine? And the answer is that it's covered with a really thick coating of mucus. We call it the mighty mucus. And the purpose of that mucus is to act as a barrier. So it protects everything underneath it, and it repels urine, right? So it repels irritants in your urine from reaching the skin underneath, and it also repels bacteria. It makes it much more difficult for bacteria to reach the skin. Unfortunately, that nice thick coating of mucus is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus, and you can get away with crap. When you're older, you have much less estrogen, you have much less mucus. That means that your bladder's ability to defend itself is now compromised. And it's now allowing the irritants in your urine to reach those fragile cells. And so if your vulva is dry and your vagina is dry, then so is your urethra, so is your bladder. That's when they would normally give you a topical estrogen so that your skin can start producing mucus again. So you need to have your doctor look at your skin and let's say if anything's going on with your skin. Then the third question that I would ask you is, when you go to pee, can you start your stream right away? Or do you hesitate 5, 10, 15, 20 seconds? If when you go to urinate, you cannot urinate right away, that tells us that your muscles might be very, very tight. And there's a condition called ischemia, which is oxygen deprivation. Ischemia happens when blood flow is restricted, and it can be very, very painful. And so if you can't start your urine stream right away, that tells me that your muscles are part of the problem. And if you've got severe muscle tension, that could be causing your pain. Muscles that are working hard build up lactic acid. It causes a burning sensation. And so if you feel burning, or if you've got pain to the left of center or to the right of center, or if you feel a flickering, like you're sitting on a cell phone on vibrate, that points us to muscles and nerves. So number one, has anybody looked in your bladder? If so, what did they see? Number two, what is the quality and health of your skin? Number three, what is the quality? What is your muscle tone? Is it tight or is it weak? Now, Rhonda asked a question here on YouTube. People with IC have lupus, just like me. Well, it's the other way around. People with lupus have bladder sensitivity. And I just did something on that in our magazine. Let me see if I can find that here real quick. Called lupus cystitis. Yeah, dear. So the symptoms we associate with interstitial cystitis may also be felt by patients struggling with lupus. And so this was a case study that was released in April about a patient with lupus who had profound bladder issues, and they treated it with a medication called Belimumab. Belimumab. I don't know if you can see that. Belimumab. And so you'll be able to read this so the title of the article is Successful Treatment of Refractory Cystitis Associated with Systemic Lupus with Belimumab. And so if you want to pop me an email, I can send you a reference to the article, or you can just get it in our magazine when the magazine comes out later this week. Or you can go to National Library of Medicine and just put in cystitis lupus, pubmed.gov, and you should find this also. All right? So it's not that every IC patient has lupus. It's that lupus patients often have bladder symptoms that they call lupus cystitis. All right? You are not alone, my friend. You are not alone. All right, guys. So we are 30 minutes late in doing our Zoom meeting. Heather said 9 minutes ago, what are the top 4 bladder building supplements? So in my opinion, number 1 is Bladder Builder. And these are kind of tied for number 2. I mean, this is a really clean formula for people who are really, really sensitive in an avocado oil base, but Sister Protect has been around for decades. And guys, it's finally completely available. We just got it took 9 months to get a shipment of Sister Protect, a normal shipment of Sister Protect. And also the price has gone down. The price has gone down almost $4 with the new owner. So all those new prices are reflected in our store now if you wanted to try the Cystro Protect. But if you have an issue with seafood and shellfish and stuff like that, then you're probably going to be doing bladder rest. And then, of course, Cystomend is another option that's available. Somebody's asking about ashwagandha. Ashwagandha should be perfectly fine in your bladder. Heather, what size? IC Network. Heather's asking me about the aloe. Aloe certainly has its place. It's been around for a long time. Aloe, it tends to be very calming and soothing to the bladder and also to the urethra. But what the research shows is that it's actually the chondroitin that is the most successful at restoring the superficial integrity of the bladder lining, which is why I always talk about chondroitin before I talk about aloe. Now, the aloe that, let's see. The aloe that I think is kind of a next generation aloe is called Aloe Path because it combines aloe with the pain fighting ingredient PEA. So when I think of aloe, I think about calming and soothing. And so calming and soothing with the addition of an ingredient which has been proven to reduce pain, I think this takes aloe to a whole nother level. And so, if you want to try the aloe, fine, go for it. Aloe, just like any of the other supplements, can cause some gut distress. And so we always say, try one pill, see how you do. If you do okay, one a day for a week, see how you do, etc. But there are some patients who are aloe intolerant. Marie said she just tried to send me stars and it didn't show up. I'm not sure, Marie. The stars are very new. You guys, if you like these meetings, one of the ways you can support us is, of course, sign up to become a member so you can get our wonderful magazine. That's just $25 a year if you read it online. Or you can on Amazon, on Facebook, you can send us stars, or you can go over and buy something in our store. The IC Network store is where you can find all the books and chair cushions and heating pads and supplements and stuff like that. I curate everything. I'm the one who chooses what we sell and what we don't sell. And I do that based upon research. We're really, back when I started the IC Network, I had a lot of people really angry at me because I wouldn't let them promote their cures, like the gentleman who told patients you could cure IC by sleeping on magnets, which of course is a load of crap. Absolutely not true. And I think that you need a place where you can come where things have been vetted a bit. I always try to look at the research and try to understand the mechanism of action. But ultimately, the American Urology Association and their IC guidelines, the treatment guidelines, they have 6 steps to treatment. You start with the easy stuff and progress to the harder, more risky stuff. The AUA says in step 1, try the supplements before step 2, you try the traditional medications, because the traditional medications are known for more side effects. If you're doing Elavil, we call it the Elavil 20, where you gain weight, you have dry mouth, dry eyes, etc. Elmeron, of course, we now know causes eye disease. And so it's our own American Urology Association in their IC guidelines, which you can print out and read. They say in step 1, try the supplements. They've been around for, especially Cystro Protect's been around for over 20 years. And many of these have research studies behind them. With IC patients showing success. There was a study of 252 patients who took this for 6 months that was published in the Canadian Journal of Urology. So it's not like these are fly-by-night companies just trying to make a quick buck. There's really IC researchers, IC people that are usually involved in the formation of the development of some of these supplements. All right, so it's time to do let me go ahead and start up Zoom. If you want to talk to me personally, And if you have questions, you are welcome to come into the Zoom chat. I'm going to leave Facebook and YouTube on so people will hear you, but they will not be able to see you. So hold on a sec. Let me just go ahead and do that. And if y'all want to Zoom, that's fine. If you don't, that's fine too. I've got no skin in this game. I am here to do what you would like me to do. So, and if you're done, you're done. And that's okay too. I'll go take a walk, which is what I normally do after I do these meetings.
Recording in progress.
Okay, now it says recording. I want you to listen to this because
recording stopped.
I never record Zoom. Okay, so you don't have to worry about that. Facebook and YouTube do record the meetings, but I don't record your faces or anything at all like that. So hold on a sec. So that is now open. Okay, YouTube, there is your Zoom invite right there. Okay, Facebook, hold on. Let me, whoops. What? Come on, Facebook, behave. I have to open up a separate window to get my link for Facebook. Hold on one sec. All right, Facebook. Here is your link to Zoom. All righty. All right. So the room is now open. If anybody wants to come in and Zoom and ask questions personally, this is the way to do it. I will let you in one at a time. Let's give y'all a couple of minutes. This is a great time for a bio break, guys. Anybody need to pee? Go for it. Good time to get up and go. I don't need to go yet because I mean, this is all I've drunk today. This is bad. I need to drink more. Any other questions? If you have any other questions, Rhonda says, I have, oh, you don't have to do it through Facebook, hon. You just need to, I posted the link right above what I just did, Graciela. Just click on that link and it'll bring you right into the meeting. We're doing it through Zoom. Rhonda said, I've often thought about stiffness in the bladder as the same as stiffness in lupus. You know, it's possible. I don't think we really have a really clear understanding of lupus cystitis. Lindsay said, what's the name of the coffee you have in your frappe? Let me go get it. Hold on. So the herbal coffee that I do is called Dandy Blend. Look, I've spilled coffee on it. So this is a powdered instant herbal coffee. And I basically do a teaspoon in a cup of warm water. And I pour half of it onto ice with coconut milk. Hi, Deborah. And blend it up in my blender. And that's how I make my frappuccinos. And then, you know, I mean, I was working with somebody last week. It was really interesting. They were really struggling with constipation. And hi, Ingrid. They didn't understand how the body works. You guys have to understand that if you're struggling with constipation, there are obviously a couple of issues. I mean, we would look at hydration, we look at fiber intake, that's important. But you also have to understand the gastrocolic reflex. The way it works, the way the bowel works is a food in, poop out process. That it is the act of eating that triggers the act of pooping and having bowel movements. And so some people will work very hard before breakfast and strain and strain and strain and try to have a bowel movement, not understanding that that's just not how it works. It's not how it works at all. That it's the process of eating that triggers that. So my go-to, if I'm starting to feel a little full, for lack of a better term, is I make 2 pieces of Ezekiel French toast with Ezekiel bread. I eat a small apple, and then I eat a large cup of something hot like Dandy Blend. And it's not a frappuccino. I mean, I just do it I just make it like instant coffee. And 30 minutes later, we're fixed. Things have moved along. Sometimes they've moved along so well that you're really cleaned out a couple of hours later. There you go, Deborah. Lindsay says, would it be okay, a okay substitute for coffee while I remove it? Yeah, I think so, because there's no acid in it. I mean, again, I think that if you got wounds in your bladder, you shouldn't put anything on it while the wounds are trying to heal. But I think once the wounds have healed, I think you can get away with more. But I think of all of the herbal coffees like Caffrey Roma, Pero, I think this one is the best. And I think the reason why it's the best is because it includes just a little bit of dandelion. And dandelion has a natural sweetness to take some of the bitterness away. I am absolutely loving this. I'm going to do a video of me making these. We're going to start doing videos. Lindsay says, awesome, thank you. My issue is more urethral and pelvic floor. So urethral irritation, again, we're going to be looking at a couple of different things. We're going to be looking at the health of the urethra. We're going to be looking at the periurethral gland. We're going to be looking at chemical irritation. But of course, we're also going to be looking at muscle tension. Are your levator ani muscles tight? So I have a really good article on our website, The 7 Causes of Urethral Pain. It's going over to icnetwork.org and click and just search for urethra or urethral pain. And you can find that and you can work your way through those 7 causes. All right. So listen, let's go ahead and do this Zoom. Now, Deborah came in first, even though she disconnected. So I'm going to go. No, yeah, you came in first. So let's go ahead and go with Deborah. Hello, Deborah. How are you feeling today?
Well, I'm currently I don't have any pain. I'm the one that had too many hydrodistensions, and I had a doctor that said to do the hydrodistension before you go into pain, once a year. That's what I used to have. And she used to do it, and it used to be fine. Then she left, and a new doctor kind of let me schedule my hydrodistension without him talking to me. And I made a mistake. I made a huge mistake. And so I had the hydrodistension. I was fine for a week because of the DSMO. Mm-hmm. And then it turns out I had a bladder infection.
Okay.
So I also have comorbid condition. I have bipolar, but real high anxiety.
Okay.
Okay. So the month of July, I've been on hydrocodone.
Sure.
And laying in bed all the time.
Okay.
So I'm so tired and I'm sleepy. And what I noticed is one factor, just anxiety have in IC flare-ups. Can just a panic attack actually cause a flare-up?
Yes. Yes. So let me, you're going to feel so good about this in the end. But it might freak you out at first. Okay. But let me just kind of go through and explain the connection here. Okay. Okay. So, I too had anxiety disorder, emphasis on had. I don't have it anymore. I did something, I'm going to explain about that. But there is a population of patients, of IC patients, who have extremely high anxiety disorder that also correlates with also having multiple pain conditions, IC, IBS, vulvodynia, TMJ, migraines, etc. So do you have anything in addition to the IC, or you just have the IC?
Just icy.
Okay. Do you have super sensitive skin? Can you tolerate wool, or do you have to have soft textures?
I've never really noticed I have a problem.
Okay. Do you have a wicked sense of smell? Can you smell things that other people can't smell? And
Yes.
okay.
Yes.
Isn't it weird that I know that?
Yeah.
Because I have that too.
And it smells like medicine sometimes. It feels like it's being pumped into the house. And I'm like, what is that smell?
Well, and okay, so here's the part that might freak you out, but don't let it freak you out because there's a happy ending here. Researchers who were studying chronic pain started doing brain scans about 10 years ago. And at the same time, IC researchers from the National Institutes of Health also started doing brain scans. And honestly, I didn't talk about them very much because I number one, I thought they were kind of scary. And number two, I just didn't understand the importance of it. But I attended a course last fall, which is mind blowing. It was taught by the International Pelvic Pain Society, and they brought it all together. So here's what these brain scans found. The brain scans found that you and I were living in a constant state of fight or flight. Okay, so fight or flight. So fight or flight means your body's preparing to run or fight for its life. Okay, and I can see you're getting upset. It's okay. We're going to turn this around. I promise you, I'm going to make this better. So let's consider and ponder for a moment fight or flight. So you have to remember that our brain is extremely animalistic. And the way that it processes information is through our senses. What do we see? What do we hear? What do we smell? What do we taste? That's it. There's no high cognition involved in your brain's defense mechanisms. Your brain is just paying attention to the input it's getting. Do you smell smoke? Do you smell smoke? Is it a fire that's going to burn your house down, or is it a barbecue? What do you hear? Do you hear sirens? What do you taste? Is it poison? Right? So your brain is always evaluating your senses. And if you've ever looked at a brain scan, it looks like a thunderstorm. It's just like different parts of your brain light up. It's beautiful. It's absolutely beautiful. And what's interesting is people who grow up with music, their brains are very different than people who didn't grow up with music. You know, the brain is constantly adapting, wiring, communicating in different ways. So anyway, what these brain scans found is that the amygdala, which is the portion of the brain responsible for fight or flight, is not turning off correctly. So let's say now here I'm in California, and you all know, no matter where you are, your air is smoky from all the fires in California. It is our stress button right now. So if I were to open my door and see a fire across the street, what's going to happen? My sympathetic nervous system, coordinated by my amygdala, immediately takes over my brain scan, my brain functioning. It has one job: to save my life. What does it do? It raises my blood pressure, it raises my heart rate, it tightens my muscles, and it prepares me to fight or flee. But now the fire department has come and the fire's gone. At that point in time, once the stressor is gone, the parasympathetic nervous system takes over, the amygdala turns off, and the parasympathetic nervous system calms everything down. It lowers your heart rate. It lowers your blood pressure. It relaxes your muscles. So a normal functioning brain is going to, amygdala is going to turn on in stress and turn off when the stress is away. But for you and for me, that wasn't happening. And so the most important course that I took, and I'm going to email you my magazine from the winter, because this goes through this in depth, okay? So by the end of this, you're going to give me your email address, and I will email that to you so you can read it, because it's going to change everything about how you're perceiving this, all for the better, all for the better. So anyway, so the conference was all about a patient who had multiple pain or whatever, and they were always going back to this brain functioning. The most important class was the risk factor class. Why does this happen to some people and not others? Because it happened to you and me, but it doesn't happen to other people. Why? So what they found is that for 80% of the kids that this happened to, it happened because of a physical trauma in the year prior to it happening, that there was some sort of physical event in childhood that traumatized their nervous system, being hit by a car, breaking their leg, or if they were an athlete, they took a lot of falls to the pelvis, like gymnasts, ice skating, something like that, that there was a physical trauma. And I think we all understand that children are not treated compassionately when it comes to pain, because a lot of people believe that children don't feel pain, right? And so I can understand untreated pain over time changing the nervous system a little bit. And that's scary. So of course they're going to go into fight or flight because they're crying, they're scared. But what about the other 20%? The other 20%, what they found is that they were either being abused or they were being bullied. So like I had a really bad bully in school. I had literally a kid in my class became a rapist and murderer, and he raped and murdered my neighbor. And from first grade through ninth grade, it was terrifying to walk out of my house and go to school. I was one of his victims. He killed my neighbor. He didn't kill me, but it could have been me at any time. Severely, severely mentally ill. Okay, so let's think about what would happen to a brain in that context. So you're a child, you go to school the first time, and you know what? This is great. Look at all these kids. And then you got a bully who hits you.
Several, actually.
Oh, right. Okay. And it's like, what? Then you go home. You may or may not tell your dad. You go to school the next time. You get hit again. And now people are laughing at you. You're on the floor crying. Okay. What happens over time is that, let's think about that brain for that child. It's the same thing for a new puppy being brought into a home that's being kicked. As soon as you walk out that door, you are in fight or flight. And the closer you get to school, you are now in hypervigilant fight or flight. It's like, okay, where is he? Where is he? Where is he? Right? And the only respite you get is when you open the door and walk into your house for 3 days. I mean, for 3 or 4 hours. And then your mom's going to say a trigger word. She's going to say, come on, hun, got to take a shower, got to get ready for bed, got to go to school in the morning, fight or flight again. So now we have a child who is in fight or flight for legitimately. You haven't done anything wrong. It's not your fault. We have a child whose brain is now customized to fight or flight. This is not a mental illness. This is a central nervous system maladaptation. It's just the amygdala just gets stuck on because of extended periods of stress.
Well, my mother was fairly abusive when I was growing up.
Right. And so number one, I mean, like, the most important thing you hear me say is that this is not your fault. You have done nothing wrong in any way, shape, or form. There is no shame. There is no blame. You were a victim like I was a victim. Okay. But here's where it gets really good. Because what we know is 20 days of bullying changes the brain for the worse. 20 days of good sensory input reverses that damage. We know exactly what to do to fix it. Mm-hmm. And the way we fix it is with good sensory input. So there's a technique that I like called I Spy. But before we even go there, we got to be real about anxiety. Every thought you're having is almost a negative thought, right?
Yeah.
Man, you are the queen of catastrophizing,
And
right?
that's what everybody tells me.
I know. Hey, you
Yeah.
can't kid a kidder. I was exactly where you are 20 years
Yeah.
ago. And not only do we catastrophize, we ruminate, where we can't stop thinking about that one thing. It's just like we're just obsessing about this one, whatever it is, right?
Yeah.
So the first thing you have to understand about anxiety is that pain that is accompanied by anxiety is intensified by the brain, because your brain, remember, it's just very animalistic. It's like you're in pain and you're crying. Oh my God, your life might be at stake. In contrast to you're in pain and you're laughing, your brain's going, well, she's laughing. Her life is absolutely not in. You don't laugh if your life is at stake.
Yeah.
So we have to understand pain processing. Pain accompanied by anxiety will be intensified. Pain that is accompanied by laughter will be minimized. Okay. So that's an important concept for you to understand. So step number 1 is improving your anxiety management skills. And that's the thing that turned me around. And I'm going to tell you exactly what the class taught me. And this, for everybody out there, I have a video on our website called IC and Anxiety. It's in our Living with IC video area. I mean, because listen, Deborah, girl, you have so many brothers and sisters who have shed those same tears, who have exactly your same frustration. And now we understand it. You haven't done anything wrong in any way, shape, or form. So for me, the way it manifested in my 20s, I had IBS, vulvodynia, sensitive skin. I had all the things that are the remnants of what happens when you're stuck there. And I used to have panic attacks before I went to the doctor because I was afraid to go to the doctor because I felt like
I'm not afraid of doctors. I'm afraid of my doctors.
Yeah, I felt like they were hurting me. But I knew I had to go. And so I would have this terrible panic attack for like 2 hours before the appointment. I'd be walking in my backyard, crying my eyes out. My neighbors probably thought I was a lunatic. And one day I was just like, God, I can't do this anymore. I have got to learn how to do this. And so, God doesn't give you the skills to deal with anxiety when you're an infant. We have to learn them. It's about skill building here. So I signed up for a class. Thank you, Kelsey. Kelsey says, licensed therapist here. She's 100% correct about the anxiety pain correlation. So Kelsey, let's see what you say about I'd love to hear your feedback about the other thing. Okay, so the class I took was called Phobies, and it was taught by a surgeon who had anxiety disorder. And for him, it was about chemical sensitivity. And again, it gets back to fight or flight. When you are stressed, your amygdala produces adrenaline. And adrenaline is a chemical mediator which tightens your muscles, gets you ready, it hypes you up, it gets you ready to do what you need to do. The challenge here is that every time you have a negative thought, you scare yourself and you give yourself a jolt of adrenaline. And so the thing right now is you got 100 jolts of adrenaline shooting through your body right now. And it's this massive chemical cascade of adrenaline, which is really driving so many of the tears, so many of the just the stress and just feeling like you're out of control. So what he said is our number one goal is to get you out of this adrenaline rush. We want to reduce the adrenaline floating through your bloodstream, and we're going to do it in a very simple way. So this is what they taught us. Every time you have a negative thought, the first thing you do is visualize a stop sign. Just stop. Because you're exasperated with yourself anyway. It's just like, stop. Just close your eyes, visualize a stop sign. Then you take a nice, slow, deep breath in for 3 and out for 3.
Is that through the nose? So you get the parasympathetic? Okay.
No. Well, it doesn't really matter.
Okay.
Okay, just in for 3 and out for 3. Now that oxygen renders the adrenaline chemically neutral. You have now just gotten rid of it. So you had a negative thought, you visualized a stop sign, you took you had a negative thought, gave you a shot of adrenaline, you visualized a stop sign, you took a deep breath, you've now gotten rid of that adrenaline from that negative thought. Okay? So it's a 3-step process: stop sign, deep breath, and then the third part is you have to remind yourself it's a thought. It has no power. And Ingrid, thank you for your patience, hon. I will get to you, I promise, but this is important here. Okay. You have to minimize the thought. And so what I say to myself is, oh my God, Jill, you're not God. You can't predict the future. For all you know, tomorrow's going to be a great day and you're going to have a fantastic doctor's appointment. Okay. So stop sign, deep breath, minimize the thought. And he said, all we're trying to do is reduce the adrenaline levels. Okay. Yeah, Kelsey, I'll get back to you too. So now what they did is they sent us home and they said, now listen, we need you to be really attentive right now. You're going to be doing this hundreds of times in the next couple of days. But we promise you, if you can get through it, we're going to get you to a better place. And I'm a chemist. I mean, I love chemistry. I appreciated the science of it. It's like, all right, I'm in. I'll give it a shot. I was stunned that when I really paid attention to my thoughts, every thought was negative. Like every single one. I had gotten so used to it that I just, you know, it's like, hey, you want to go to the store? No, there won't be bathrooms. Hey, you want to go for a walk? No, there won't be a bathroom. Hey, you want to have sex? No, it's going to hurt. Hey, you want to take a drive? I lost a great opportunity to take a drive with the CEO of a local computer company because my immediate reaction was to say, no, it'll hurt. No, it'll hurt. Okay. So they said, be attentive. And so I'm not lying. In the first day, I easily did it 100 times. The second day, about 50 times. Third day, about 20 times. 5 days later, I was doing it once a week. Or once a day, not once a week, once a day. And for the first time in like 20 years, I was calm. It was like, oh my God. I had no idea of the massive load of adrenaline shooting through my body that was driving all of the panic attacks, all of the fear, all of the tears, all of the anger. And once we got the adrenaline back down to lower levels using that technique, I have not had a panic attack since I took the class. And I know exactly what to do. When I catch myself having a negative thought, it's immediately what I do. Stop sign, deep breath, minimize the thought. I went through emergency cancer surgery 4 years ago. I didn't have a panic attack. I was doing that in the car. Okay. And so this is, and there are other things that you can do for anxiety. And I encourage you.
I do like nighttime, like sleep hypnosis, where you're breathing, controlling your breathing. I do that at night, things like that.
Well,
I meditate.
Yeah, but that's not addressing the adrenaline.
Okay.
We have to address the adrenaline. We've got to get you out of that adrenaline cascade. That's not quite the right word. Adrenaline overdose. That's basically what he was saying. It's your body's reaction to massive amounts of adrenaline. And so I want you to try that. There's no harm in that. Stop sign, deep breath, minimize the thought. And I will tell you, it absolutely changed my life. And I'm not lying. I have not had a single panic attack since I took that class because, man, I nipped that in the bud. And I will say it baffles me. The whole negative thought process baffles me. We've had a lot of experts in our lecture series, and I've asked many of them, why do our brains turn negative? Yeah, why do our brains turn negative? And their answer is basically that it's chemically easier. It's easier to be negative than it is to be positive. Yeah. So you and I have to work on that. The other thing that I do, and I don't know if you can see my office here, is like, I surround myself with happy things. Things like this. I got stuff like this everywhere in my house.
Yeah.
And that's because I love Norman Vincent Peale, The Power of Positive Thinking, which I think is amazing. Okay, so now let's get back to kind of what Kelsey's talking about here on Facebook, and that is sensory information. The last piece of this puzzle is, how do we turn the amygdala off? So we're reducing the chemical load. That's good. But again, we have to get back to this very animalistic nature of your brain. It's processing sensory information. And one of the best ways to do this, you can do tapping.
I've tried that. Yeah.
Okay. And what's good about tapping is that you basically start with a karate chop, right? 7 times, and then you repeat an affirmation, something that's important, like I can do all things, or I am strong, or I am capable. Normally when you're doing tapping, there's an important message you're also reinforcing. But tapping fundamentally is focusing your brain on something else, and it's focusing your brain to focus on that area. It's forcing your brain to focus on that area. So with tapping, you start with the karate chop, 7 times, repeat whatever you're working on 7 times, and then you go here 7 times, then you, right? And so you can go to YouTube and you can search for tapping, and there's some really good therapists that do it. And what the research shows, they've done extensive research studies with PTSD patients, gentlemen who've come back, or men and women who've come back from war who are suffering from PTSD. And just that tapping process alone leaves their amygdala turned off and their parasympathetic nerves on for hours. So doing tapping once a day is really, there's nothing harmful to it, and it helps force your brain to turn the right things on. Okay, but let's do the one that I love. It's called I Spy. And it's about good sensory information associated with something good contextually. So guys, I usually do this in every meeting. So let's just go ahead and do it. So we're going to do I Spy. Everybody who's watching, people on Facebook, people on YouTube, people who are watching this tonight, who are not here right now, because about 1,000 people watch this usually in the first 24 hours. Okay, we're going to do I Spy. So Deborah, I want you to pick something in your room that's just pleasant to look at. Right? And just so I've got butterflies up on this lamp. So just like, okay, it's cool. It's a butterfly. It's pretty. It's white and blue, and green eyes. It's on a leaf. Just look at it briefly. Okay, now let's take a nice slow deep breath in and out. Okay. Now, what do you hear aside from my voice? Can you hear anything in the background?
My kid.
Okay.
Yeah.
Okay. So let's just focus on that. Focus on that. So for me, it's my parents are watching TV. Okay, so let's just listen to that just a little bit. It's okay. No threat. Now let's take a nice slow deep breath in and out. Okay. What can you smell right now? Can you smell anything right now? And this is where aromatherapy really works. So I got some rose spray. Okay, so I'm just going to spray a little bit of that. So if you can smell anything, let's just focus on that. Another one of your senses. Now let's take a nice slow deep breath in and out. Okay. Can you taste anything right now? Just pay attention to your taste buds. Can you taste the milkshake you had, the frappuccino you had, your lunch? Can you taste anything right now? Just think about, what do you taste? For me, frappuccino. Okay, let's go in and out. Okay, and last but not least, I want you to take your hand and I want you to rub it over your chair, because you're probably sitting on upholstery that has a texture. Or if you're wearing jeans, rub your hand over the texture. Again, your brain's going, I don't know why she's doing that, but it's fine. Not a problem. There's absolutely no threat here. But you're forcing your brain to listen to and observe this sensory information. Okay, now we're going to take a deep breath in and deep breath out. Okay, now comes the fun part, because now we're going to add context. All right. If you could look at anything that would put a smile on your face, Deborah, what would it be?
This actor I like from Battlestar Galactica.
Okay, say that again.
This actor I like from Battlestar Galactica.
Oh, which one? Which?
James Callis, Gaius Baltar.
Okay.
I have a huge crush.
Okay. Okay. So look, it put an immediate smile on your face. Immediate smile on your face.
Yeah.
So everybody doing it. Immediate smiles. Now let's take a nice slow deep breath in and deep breath out. Okay. If you could smell anything that would put a smile on your face, what would it be? What smell would make you smile?
Lilac.
Okay. And for me, hot cinnamon roll every single time, or hot apple pie. So just live there for a couple of seconds. See, it makes me want to make an apple pie. In and out. If you could hear something that would put a smile on your face, what would it be?
My grandson's voice.
Perfect. And for me, it would be John Denver or Kenny Loggins or Christmas Carol, something like that. Okay, so let's just live there for a moment. Just pretend you're hearing your grandson's voice. I'm hearing Rocky Mountain High or Calypso. Let's take a nice deep breath in. Or the Pooh song by Kenny Loggins. And out. Okay. If you could taste something that would put a smile on your face, what would that be?
Watermelon.
Perfect. And for me, cinnamon roll, hot cinnamon roll, every single time. It's like brain orgasmic for me for some reason. Okay, so just live there. Nice, fresh watermelon, 4th of July. People are smiling and happy. And oh, it tastes so good. It's a hot day. Let's go in and out. What could you touch that would put a smile on your face? What could you touch that would put a smile on your face?
Drawing a blank on that one.
Well, your grandson's hair.
Yeah, that's true. Yeah.
Right? A cat, a dog, a hug. Yeah. All right. So let's just live there for a moment. Just pretend that you're rubbing your grandson's back or something like that. And for me, it would be giving my 92-year-old mom or 98-year-old dad a big hug. And let's do a deep breath in and out. Okay. Okay. Now, how do you feel?
Completely different from when I came on the call. Okay,
because we have turned your amygdala off. We have turned your sympathetic nervous system off, and you are now being functioned by your normal, healthy part of your brain.
Yeah.
Now, 25 years ago, when my urologist said, you need to take a mindfulness class, a mind-body medicine class, I yelled at him and I said, don't talk to me about that. And hello, master's degree in psychology, and I still yelled at him. Like, I can't sleep at night. For God's sake, my bladder's screaming. I want you to remove it. Don't talk to me about mindfulness. He was smart. I was uneducated. I did not understand that it was my central nervous system that was really controlling everything. And so our therapeutic priority for you is very different than our therapeutic priority for somebody with Hunner's lesions. We know exactly what to do. And that is, we got to wind down the anxiety, and we got to do really good, healthy sensory work to get your central nervous system in a better place than it is. And you just admitted it, and I can see it in your face.
Yeah.
You are a different person. And what the research shows is that this is going to last for a couple of hours and then you're going to go into your negative thoughts again. Okay. But it's about training. We're now into training.
Right.
We're now into training. And so the take-home message here, what the research shows is that mind-body medicine, 20 days of mind-body medicine reverses the damage of 20 days of bullying. Okay? Mind-body medicine works, and it works beautifully. So this is what you have to add.
Okay.
This is what you have to add. But to me, the most important part for me in my life, when I say that I had anxiety disorder, is that simple anxiety management tool that they taught me has nipped it in the bud. It has given me a skill that I have practiced for 20 plus years, and it works beautifully for me personally. Okay. And I want you to try that. Stop, sign, deep breath, minimize the thought. If you have a therapist that you're working with, ask her what she thinks of that, or him what they think of that. But it would be fascinating to see if you had a similar effect. Now, I've had this discussion with a lot of people, and nobody's ever said it didn't work. All we're trying to do is to restore. We're trying to get out of fight or flight, and we're trying to reduce that adrenaline levels. And I think you will be absolutely stunned a week from now to see how you feel once we've gotten rid of all that adrenaline shooting through your bloodstream.
Okay.
Would you be willing to try it?
Yes.
And what I want you to do is I want you to pretend that I'm right next to you, because we are sisters in this. And you know, if it when I took my anxiety management class, I will tell you, and Kelsey, I think you can agree with this. And Kelsey has something that she wants, that she's offering some really good tips here on Facebook. In my 20s, when this was really building up, I really thought that all you had to do was look at me and see how messed up I was. Like, it's just like, it's got to show. You know, I just felt so profoundly damaged. And I felt like it was my fault. And I felt like not only was I being punished, but that I deserved to be punished in a way. And I think you know, because I can see it in your face, you know exactly what I'm talking about. But when I took the class, it was mind-blowing because I walked into a room of completely normal people. And in fact, the people who won the state lottery in the state of California were in my class because they won the lottery and they developed anxiety. And what that class taught me, in addition to these great skills, is that it wasn't just me. That this is what happens sometimes, and it's okay. We just have to admit we don't know what the hell we're doing with our anxiety management skills, and let's learn some. So come on over to our website. You can watch my video on this. Now, see, as soon as I said that, I could see your face changed.
Yeah.
Okay. So let's go back to, if you could look at anything that would put a smile on your face, what would it be?
Your video.
Okay. Your grandson. Just, again, let's get that good sensory information back in there.
The ones from earlier. Yeah.
Okay. That's your go-to every single day. And this is the perfect go-to for children who are anxious, because they're doing the same thing. Imagine that child who's being bullied. Let's restore their good brain function too. So sitting with your grandson and going, if you could look at anything that would put a smile on your face, what would it be? And let's get them in that happy space too. And you're going to love it. You're going to love it. So my email address, my email address is icnetwork@mac.com. icnetwork@mac.com.
Mac, M-A-C-K?
Yeah, no, just C, no K. icnetwork@mac.com. I want you to pop me an email and I will send you back the magazine that I dedicated to this last January so that you can read all the science.
Okay.
And I think it's just going to blow your mind. So Kelsey says here, anxiety manifests in such bizarre ways. It can create physical problems when there's no medical cause. You have to get the cat out of the tree first so that you can improve. Exactly. Laura says these are great for stress.
Do not open my door.
What was that, Ingrid? Ingrid, are you talking to me or somebody else?
My son.
Okay, just two more things. Kelsey says, you were talking about negative patterns earlier, and I thought I'd share a short exercise. It's about having patients say the opposite. I'm not always going to hurt. I am healing. I am okay. The power of affirmations of positive thinking. I can do all things through Christ, or whatever you want to say, through nature, whatever. I can do all things. Every day in every way, my life is getting better. That which is done for you, let it be done. That which you must do for yourself, do it. My favorite one is be bold and mighty forces shall come to thy aid.
Oh, I love that. That's from Almost Famous, the movie.
Yes.
Be bold
And
mighty forces.
that's actually Norman Vincent Peale.
Yeah, I think they quoted it in the movie.
Okay, so let me just end, I'm going to end this with this, and then Ingrid, we're coming to you. Kelsey says, in the book you recommend, Breaking Through Chronic Pelvic Pain, it discusses Eastern medicine thought of our emotional physical life, source being at the pelvis. When things go wrong with our pelvis, it throws us out of alignment and causes a very raw anxiety and panic response. The Body Keeps Score is another great book to read. This is all about the trauma response. And she recommends an app called Clear Fear to clients with anxiety. It helps with breathing, guided meditation, anxiety education, and safety planning. And we're all just going to find, it's a journey, finding the thing that resonates with you. But I will just say that for me, what resonated for me as a chemist was reducing adrenaline levels. And it, it just worked beautifully. So Deborah, big giant hug to you.
Namaste. Thank you so much.
Do you feel better? Do you feel better now that we talked?
You don't know. You're better than any doctor. You're just awesome.
Girl,
Thank
this
you.
is the best part of support groups, is that we are here for each other. Yeah. And of course, my job is to send you to your doctor so you can credibility test those with your doctor. But I feel confident in saying that for those, just give them a try. And then let me know how you're doing in a couple of weeks. And I think you're going to be a new woman. And just remember, the past is past, just done. It's over. We're focusing on today and tomorrow. Okay? Big giant hug to you.
Thank you.
Okay.
I'm going to stay around. I'm going to listen.
Thank you.
Thanks, Ingrid, for waiting so long.
All right, Ingrid, my friend Ingrid, how are you doing today? How is life?
It could be better.
Okay. What's going on?
Well, with my knee, like I was telling you about, I'm not being able to walk correctly. I can't bend it. There's a lot of scar tissue, and they're saying that they think it's because of my IC, and then plus with the scar tissue.
So wait, you had a knee replacement?
Yes.
Or you had a mechanical knee replacement. So you don't even have your original knee. You've got metal.
Yes.
And are you saying the metal won't bend?
The metal will not bend. If you can see.
Oh.
That's how my knee is. I cannot bend it. It's stuck.
Is it locked? Is it, sometimes what happens with artificial joints is that they can lock in some way. I mean, does it feel?
Yeah, it's locked. I mean, it hurts.
It hurt. Okay, it hurts. But can you move it even if it's screaming in pain, or are you completely unable to move it?
I can move it a little, Jill.
Okay.
But I mean, not to where it needs to be. No.
Okay. When did you have your knee replacement?
May.
Okay, so you're still fresh. I mean, you're 2 months out. You're 2 months out of it.
Yeah.
Did they have you in physical therapy?
Yes, they do.
And is a physical therapy agonizing?
Very. Very. They try to bend it. And when they try to bend it, I mean, I'm not trying to be mean, but I want to punch somebody in the face.
Oh, yeah.
Like it hurts.
Oh, hey, listen, I got to tell you, when they tried to do physical therapy after my hysterectomy, I would have punched him in the face. Like, you're not touching me. No way, no hell.
And I have IC on top of it too. And I don't know if that has a lot to do with it. I mean, I get bladder infections. I mean, like every month, Jill. I'm in the hospital. I have a PICC line put in my arm because my body has built up a resistance to the antibiotics. So they have to do it
Do you
through
have
my
a
PICC line.
you have a PICC line now for that purpose?
Yes.
Holy shit. Excuse me for
Yes.
you guys,
No, I'm-
excuse me for swearing, but they
No,
do,
I know.
for everybody watching, it does pop out. I'm human and stressed like
Mhm.
everybody else is right now.
No, I know.
Well,
That's
let's separate. We have to practice a divide and conquer strategy here, and you have to do this too.
Yeah, I know.
To assume that everything's lumped together is very unfair to you, because there's not going to be one treatment that's going to fix everything. I mean, your knee is a separate and distinct issue. Let's step away from that for a moment and let's talk about your recurring UTIs. So the fact that you've been hospitalized every month with a recurring UTI is shocking to me. I'm not, and I'm so sorry that you're going through that. How long has that been going on?
I got diagnosed with IC 2 years ago. And
But we're not talking.
probably-
But we're not talking
I'm
about
just
the
saying,
IC.
probably about maybe 3 months after that, I have been in the hospital almost every month since then. Yes.
Okay, how old are you?
I'm 40.
Wow. Have you had a hysterectomy, surgical history? You have. When did you have your hysterectomy?
Last year, June.
But it started before your hysterectomy.
Yes, they wanted to do the hysterectomy. I had cysts on my ovaries also, but they thought maybe that would help with the urinary tract infections and my IC.
Okay, so so again, I'm focusing on the recurring UTIs. What have they identified the bacteria? What's the bacteria? E. coli, staph, strep, micrococcus. Okay. So it's very important that you start tracking the species, because if it's the same E. coli over and over and over again, then you either have a super drug resistant E. coli or there's something in your daily life that's inoculating you constantly. The perfect example of that is bath jets in a bathtubs that have not been installed correctly. Normally, bath jets point downward slightly so water can drain out of them. But if they're level or they're this way, the water collects in them and they become super bacteria factories. So
I take showers. I don't even take baths anymore for that simple reason, because I thought maybe that's what it was too, with my urinary tract infections from taking baths.
Were you
I don't even take baths. I take showers.
Okay, so let's go to before you had your hysterectomy. Were you having really painful periods? Or were they normal?
I was having very heavy. I mean, they were kind of painful, yeah. But I mean, it wasn't anything that I wasn't used to, I mean,
Okay.
but I mean, very like heavy. I would have to wear, like, I would change a big pad probably 2 to 3 times in an hour. It was big.
Did you have fibroid tumors or endometriosis, anything like that?
Endometriosis.
Yeah. Okay, so you had endo. Did you have a lot of endo or a little bit of endo when they did your hysterectomy?
I didn't, I should have probably asked that. I didn't ask that. They just told me endometriosis, so.
Okay, so let's go back for a moment to the species.
That is one of my concerns too, because.
So I think one of the first things that I would do if I were you is, number one, I would go back into your medical records, if at all possible, to every single test you've had and get the species. Let's track the species over time. Is it really E. coli every time? And if it is
I used to have them when I was younger too.
Well, okay.
I mean, this has been an ongoing thing since I was really little.
Sometimes there can be a very small birth defect, that it can be a tiny tube that connects the urethra with the bowel.
Okay.
Or sometimes
I had something like that. It was I was in the hospital and they rerouted my urethra.
What?
That sounds
What?
they put my tubes that were going through my urethra was clogged, and they put like a new one in. But it was when I was little.
That's huge. That's huge. So what the hell did they do? Did they remove your urethra and build a new urethra with some sort of tissue?
From what I would see, my mom and dad aren't. Oh, they passed away. So my mom would have known all this information, and I should have probably got it from her. But I know, like the tube, it was not latex, but it was like a tissue that they put a new, the new tube in.
So, well, you've got two tubes that are ureters to go from your kidneys to your bladder, and then you have one tube coming out. That's your urethra.
Right.
So it was either a ureter or it was either the urethra.
I think it was the urethra. Urethra. I'm not saying it correctly.
Well, that kind of supports the fact that maybe there's some sort of defect with that new urethra, or I mean, we don't know. I mean, I think it'd be really, have you told your urologist about this?
Yes.
Have
And
they?
they blame it on IC. That's
No,
what they
no,
tell
no.
me.
I know, but
I know.
but
I know.
we're not doing that.
I know.
His IC patients don't have infection. You're legitimately having infection. So there has to be, you are excluded from a diagnosis of IC by the American Urology Association because you're having recurring infection. That puts you in the recurring UTI group. So the question is, why is your body more vulnerable to UTI? Concept number one is estrogen atrophy, but this happened before you had your hysterectomy. Concept number two is that there's some sort of mechanical way that bacteria is being delivered from your bowel to your urinary tract. Sometimes bacteria goes along the skin. Sometimes there can be a little tube that connects them. And the other thing is that your urethra is a mucous membrane organ. It's covered with a really thick coating of mucus. And the purpose of that mucus is to protect your fragile urethra and to repel bacteria. But if they put in tissue that was not mucosal, maybe you don't even have a mucosal layer in there.
Wow.
Right?
Yeah.
I mean, something is fundamentally flawed here.
Yeah.
So I think it would be, again, you in your mind, you got to separate cause versus effect, and you kind of have to reinforce this with your doctor. It's like, listen, recurring infection is separate and distinct from IC. There's a reason why I'm getting recurring infection. It's either estrogen atrophy or it's related to my new urethra. Maybe there's some sort of flaw with that. I think it'd be really interesting. But again, I'm nerdy and geeky in literally letting them look at your urethra with a cystoscope. Might not be the funnest thing in the world.
No.
And it could be quite tender. But it would be fascinating to see what that tissue is.
Yeah.
Because you're in a separate and distinct group. Now, if it's E. coli, then doing a preventative is going to be really important. So hold on, before we even go there again, the third thing I would do when you go and identify the species, especially if it's E. coli over and over and over again, next generation urine testing is a must. Okay. Because I just found mine. Here, hold on. Where did I put mine? Next generation urine testing will give you the genetic identity of the exact type of E. coli, because there are many different types of E. coli. So what they do is they get the DNA from your urine and they compare it with big national databases, and they will tell you what variant it is. So let's see here. So they don't just say E. coli, they're going to give the second word. And that's what we want to know. That we want to know if that's the same over and over and over again.
Okay.
So let's see with this test. This is not my urine test. This is my vaginal swab that I did. But to give you a clue, so I had a microgen test, and I just don't know if you're going to. So these are the 4 species that they found. Can you read that?
A little bit, yeah. There you go. Okay, yeah. Okay.
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 And then if you follow it along, they then have check marks
On where?
horizontally. They have check marks that correlate with different antibiotics.
Okay.
And and so they will tell you. So basically, there are millions of bacterial DNA in this giant archive at the Center for Disease Control and the National Institutes of Health, including drug-resistant E. coli. And so based upon that data, they can then tell you which antibiotics would be the most successful in killing that specific one.
Okay.
Of course, the challenge here is that it's going to tell you everything. It's going to tell you good bacteria. It's going to tell you bad bacteria. It's going to tell you fungus. And given your history of antibiotic use, you probably do have a little bit of fungal overgrowth too. And so you are, in my opinion, the perfect candidate for next generation DNA urine testing, because this has been happening so regularly. And it's just like, okay, I just want to know, what do you find? What's in there? Let's just look at it. It's data. You don't attach any emotion to it. It's just data.
Right.
It's just useful information and data. So I would want something like this also.
Okay.
Now, in terms of prevention, again, we don't, if you are in a situation where let's just say your urethra is a culprit, that it maybe wasn't constructed correctly, then they might be able to fix it. I don't know. Using something that contains proanthocyanidins would be your defense, right? PACs. So do they have you on Allura or D-mannose or anything?
I take D-mannose. I take Almiron.
We're only talking about the UTI stuff.
D-mannose is what I take.
So D-mannose is not as effective as PACs.
Okay.
PACs are called proanthocyanidins, and the 2 brands are Allura, ELLURA, or Prevent, PRVNT. Okay. And you can look at, do your due diligence. You can look at the research, go to National Library of Medicine, look at the studies, but it's really the PACs that are the most effective at preventing E. coli from attaching to cells and infecting cells. I will tell you, the Allura runs $125, $150 a month. I know that because my sister takes it. Prevent is about half the price. And so we have the Prevent in our store, but we don't have the Allura in our store. So we have to really think about prevention. So, yes. Okay, so that's a separate and distinct issue. Now, you also they also tell you have IC, but you are excluded from a diagnosis of IC because you are active UTI. So that they given you any other reasons to say why they might say you have IC?
That's why they said I had IC, is because I get urinary tract infections all the time.
Well,
that's what my
they have. Yeah. You really are more of what you would fit more is actually genitourinary syndrome of menopause. These patients are the ones who keep getting the recurring infections, and they're often misdiagnosed with IC, or it would be IC subtype 2 bladder wall driven estrogen atrophy. That IC patients do not get recurring UTI.
Wow.
They do not. And again, the presence of bacteria excludes a diagnosis of IC in the AUA guidelines, and we've known that for 20 years. But the patients who do get recurring UTI are generally in estrogen atrophy, you know, and
Okay.
so did they have you on Lupron for your endometriosis? Because
No.
that's a chemical menopause.
Yeah, no, they have me on something for it. I can't remember the name of it though.
Did it stop your periods?
Yes.
Oh,
yes.
well, then you, okay, so you were in menopause. It doesn't matter
Yes.
if it was due to aging or chemistry. So you fit the genital urinary syndrome of menopause diagnosis perfectly. Your estrogen levels dropped because you had endo. You started getting UTIs because your tissue just couldn't defend itself because it didn't have enough estrogen. So do they
So
have?
then do you think I have IC?
No,
Or, I mean,
you are
wow.
excluded from a diagnosis of IC by
Wow.
the AUA. If
Wow.
you go 6 months without infection, or maybe or 6 weeks, well, it depends. It depends on the criteria you use.
Yeah.
If you are infection negative for a period of time, let's just say 6 months, and you still have pain, then you might fit the diagnostic criteria of IC. But let me just, you are more a genital urinary syndrome of menopause patient. Let me just look something up here real quick. Hold on. This is a thing. I really think that some doctors are just not motivated. They're just like, yeah, you're just getting older. Yeah, it happens. Or yeah, you got this incurable bladder disease. Get used to it. Or
Yeah.
and they're not necessarily really focusing on trying to.
I mean, my doctor really went to the extent of doing a bladder thing where, I mean, he circled like, oh, see how red your bladder is. You have IC. And I mean, I this whole time, this is what I thought.
Well, but your bladder is going to be red if it's infected too.
Exactly. Wow.
So I mean, now listen, that's my opinion. I'm not a doctor. He
Yeah.
went to med school. I didn't. I did not go to med school, to my regret. I
Right.
should have.
Yeah, I think you should have.
Well, I almost did.
You're telling me a lot that
No, I'll tell you why I didn't. I had I have a pharmacology degree with a surgical internship. So I did surgery for a year on animals, and I never lost an animal. I saved every animal that I ever worked on. But I was a good surgeon. I was fine with the surgery. What I wasn't fine was with the math of the pharmacology, and I did not think that I had enough of an intuitive grasp of dosing. I just didn't think that, and I've since had like this doctor from Harvard that's a good friend of mine. She was like, Jill, we could have helped you with that. And it's like, oh, I don't know. I don't know. That's why I didn't go to med school. I could have. I just
You should have, believe me, because you're teaching me a lot that I mean, I've been puzzled. This, I mean, like I said, I've gotten so upset, and I mean, it's just so baffling to me why I keep getting these, and all my doctors say is, oh, it's normal, it's because of your IC, and there's nothing we can do, and it's like, but my body's building up a resistance to antibiotics.
No, and that's not true either. Your body does not build up a resistance. The bacteria themselves build. So they're phrasing it like it's your failure, and it's not. It's that the bacteria are remarkably adaptive. It's like COVID. COVID is mutating. Yeah. Well, the bacteria mutate too. They mutate in response to a threat.
Okay.
I just wanted to see if I could give you that reference for that. If you call me on Tuesday, I can try to give you a little bit more information on that.
Okay.
I can just tell you that for 25 years, everything has always been, if a patient has active UTI, they are excluded from a diagnosis of IC.
Okay.
If they're completely, here, hold on, wait a second. Here it is.
Okay.
The bladder disease complex includes a large group of patients with bladder, urethral, or pelvic pain, lower urinary tract symptoms, and sterile urine cultures, many with specific identifiable causes. IC comprises a part of this complex. The panel uses the IC definition agreed upon by the Society of you don't know that. Okay. The core fundamental definition of IC, an unpleasant sensation perceived to be related to the urinary bladder associated with lower urinary tract symptoms of more than 6 weeks duration in the absence of infection. That is a definition of IC established by the American Urology Association, established by the Society of Urodynamics and Female Urology, established by the European Association of Urology. So anybody who tells you that infection is part of IC is crazy. And I'm going to give you this link right now so that you can see this.
Okay.
I'm going to, here, hold on a sec. So I need you. So here's the deal. You have every right to be angry, but anger is not going to get you anywhere.
No, it's not.
And so what we're going to do instead is we're going to walk in with facts. We're going to walk in with facts. And the way you're going to do that is you've got to separate in your mind. You cannot mix all these together. So concept number one is, why the hell do I have recurring UTIs? Is it related to my estrogen atrophy, which is very probable now, but it could also relate to whatever the hell they did to your urethra. That is separate and distinct from your knee. Your knee has nothing to do with your bladder. What your knee has to do with are your muscles and your bones and potentially your pelvic floor. The odds are, because your bladder's been in pain from all these UTIs, your muscles are tight. And now we've got another reason for them to be wicked tight, and that is you're limping because something is wrong with your knee. Something went wrong. So, have you gotten a second opinion from another orthopedic surgeon about what's going on with your knee?
I am right now.
Good.
I'm in the midst of it. Tuesday I go get my MRI. So we're on board with that, because I'm not going back to my other.
Because there may be something mechanically wrong with the implant. I mean, that happens all the time.
Yeah.
In fact, my brother-in-law's sister had her hip replacement go bad immediately, like immediately. So she dislocated it twice in 2 weeks, and now they had to replace the whole thing. So we have to rule out mechanical problems. And then the other thing that could be happening too, I think, is that your nervous system might be a bit more sensitive. And because you've been in pain for a long period of time, plus you're anxious, plus you're angry, and you have to follow some of the same, insights that I gave to Catherine, that
I did when you were doing that. I was doing it too, and I wrote it down.
Stop sign, deep breath. Remember that your any pain accompanied by anxiety is going to be intensified. So you got to laugh every day.
Yes.
And
smile. That's what I try to do.
Yeah. And I want you to be really proactive here. I mean, you haven't done anything wrong. Anybody who tries to tell you this is your fault is full of crap. You are going to them because you are trying to understand why your body is messed up. You want to know why your knee isn't functioning normally, which is very abnormal. And you want to know why you're getting recurring UTIs. Okay.
Yes.
So carry hope in your heart. If you need, and if one of the things they taught us in our anxiety management class is, if you're walking into a situation and you're feeling a little bit insecure, number one, you have to do the power pose before you go in. Even if you're feeling weak and vulnerable, because when you do this, you're actually changing brain chemistry. You are changing brain chemistry, and that's important. That will help you walk with confidence into that. And don't put your doctors up on a pedestal. Talk to them like an equal, and you're paying them. They're not paying you. You're going there and you're saying, I want you to study my body to help me try to understand why this knee is not working or why I'm getting recurring UTIs.
Yeah, what's going on with me? I mean, that's all I've been wanting doctors to tell me. I mean, they put me on all this medicine and I take it religiously every day. And it's like, if I shouldn't be taking this, why am I taking
Well,
it?
you are according to the AUA, and I gave you that link. And if you scroll down and you go to the background section, you are excluded from a diagnosis of IC with a positive urine culture. Okay.
Okay, thank you.
Last but not least, if you just feel like you need somebody there with you, pretend I'm standing right next to you. Okay.
Thank you.
Okay,
Thank
hon.
you so very much.
Nice talking with you. I wish you well,
Talk to
Ingrid.
you. Thank you.
Okay, we're going to shut down this Zoom. We are done. All right, guys. No, I do not want to update this computer, for God's sake. All right, YouTube. Sierra, I'm sorry, I missed that. Hon, you can call me on Tuesday. I'd be happy to talk to you. You guys couldn't get in? The link should have brought you right in. Okay. So for anybody who couldn't get into the chat, you can call me on Tuesday. Call me this week, and I'll spend some one-on-one time with you, okay? All right. So what did I miss? Did I miss anything? No, you can look at you guys. Look at you guys being all together. All right, my friends. Well, this has been a great day. I hope that you're feeling better listening to this. I want you to carry hope in your heart. You know what? Carry hope in your heart. You can do this. You're tough. You're strong. You're educated. You're informed. We're going to get to the bottom of why you might be having pain. So on this, I'm going to give you your homework for 15 minutes a day. I need you to do something for your spirit. I don't care what it is. Go out and sit in the sunshine, go to church, whatever floats your boat. Do something that will give you some peace. And that's really hard right now. We all need that. COVID is tough. And turn off the TV, for God's sake. Don't listen to social networking and all that. Just turn it all off once we're done. For 15 minutes a day, I need you to do something for your noggin. Come on, let's get this knowledge level up. Read an article a day. I'm reading an investing book. I'm reading one chapter a night before I go to bed because I have got to improve my money management skills. For 15 minutes a day, I need you to do something for your bladder or your pelvic floor. Get down on the floor, do your stretches and exercises that your physical therapist told you to do, or make an IC-friendly meal, or do I Spy, something like that. And for 15 minutes a day, I want you to laugh. The most important thing is laughter. Pain accompanied by laughter will be minimized by the brain. Pain accompanied by anxiety will be intensified by that brain. And Kelsey, I'm not sure if you're still here or not. You guys on Facebook, you guys have gotten pretty quiet. Where is it? Where is it? I just had it out. Ah, here it is. Anybody out there struggling with pain, pelvic pain, this sweet little book, look at how small it is, will give you so many tips. This is such a great book. It explains how the pain is happening. It explains all the ways you can interfere with pain processing, but it's really sweet and easy to read and great diagrams. One of the things I love, I just laughed. Yeah, because the last 5 years have been tough for all of us for a number of different reasons. One of the things, anyway, there isn't a page in this book that isn't good. It just teaches you so much about why it's happening and why it's continuing to go. Alleviating pain, targeting by brain processing. Look at this first one. Use foul language when the pain gets really intense. Okay, you know what that means? You can curse. It's okay. You don't have to hold it in. What did you just say? If you've ever hit your thumb with a hammer or stubbed your toe on a table, you probably sworn, or at least wanted to. This kind of reactive vocalization starts in the lower brain gateways. It's a spontaneous reaction to pain, and it actually reduces the pain signal. Now, I'm not suggesting picking up a general swearing habit. This only works when you're not accustomed to using foul language regularly. And if it's against your morals to use foul language, then you can go to the next technique. And she talks about meditating and deep breathing and positivity and starting yoga. And then also, hey, one last thing. I'm going to be sending out an email about a brand new research study at the University of New Mexico. They are looking for women who would like to participate in a brand new pain reducing program that combines yoga and mindfulness. And it's very exciting because you can do it from your home. So I'm going to be sending that out sooner rather than later. All right. So y'all can get this book on our website too, if you would like it. I think it's a game changer. All right. And Kelsey, here, I'm going to shut off you guys on YouTube. Peace be with you. Peace be with you. I'm shutting off YouTube. I'm leaving Facebook on for a moment because I want to talk to them. Bye, YouTube. Love you. All right.